Nama kota atau provinsi? Trenggalek. Oh, banyak ya fisioterapinya ya. Yang mana ya? Ini aja deh. Oh, ada nomor teleponnya. WhatsApp juga bisa. Wow, ada mapnya juga. Aku buka lokasinya aja deh. Oh, tempatnya deket nih. Ya udah, aku mau ke sana aja deh.
Setelah 800 meter, belok kiri.
Agak cepetan dikit juga nggak apa-apa ya Bang ya?
Ya Mbak.
Tujuan Anda berada di sebelah kanan.
Anda sudah sampai di lokasi.
Alhamdulillah, udah sembuh, udah enak sekarang. Semudah itu ya ternyata pilih fisioterapi.
Pilihfisioterapi.com adalah website yang didirikan oleh Ikatan Fisioterapi Indonesia untuk memudahkan masyarakat Indonesia menemukan fisioterapi di kotanya. Jika Anda membutuhkan fisioterapi, pilih fisioterapi.com.
Introducing the newest Body Charger Recumbent Cross Trainer GB7006. This product uses a commercial-grade frame structure to make it durable for any user. It features a 20-inch oversized ergonomic seat that can make all users feel supremely comfortable during their exercise, with a reclining seat for effective back support. The GB7006 Recumbent Cross Trainer comes with a 90 to 180 degrees swivel seat, making entering and exiting safe and easy. The large supportive foot pedals and foot straps make the lower body supremely comfortable with less foot stress. The seat system is fully adjustable and can move forward and back with 14 different seating positions. The multi-position ergo grip handles makes it easy to find the proper shoulder length. The GB7006 provides natural stride motions. During the workout, the console displays various exercise information with 16 levels of resistance. The console features 18 exercise programs, including constant training. Want to save your results? Insert a USB flash drive. The GB7006 is a true low-step, through-designed product, allowing the elderly user easy entry, also integrated with a safety sturdy grab ring for convenience and support. The GB7006 features low starting resistance and an easily readable console. The low-impact workout can meet all of our users' standards, even for the elderly user. The GB7006 Recumbent Cross Trainer is a great product for a total body workout. Want to know more about this product? Visit Body Charger's official website and make an inquiry at www.bodychargerfitness.com.
Para tenaga kesehatan sangat antusias mengikuti program vaksinasi COVID-19 dari pemerintah, sekaligus sebagai bentuk kesadaran akan pentingnya suntik vaksin mengingat mereka selama ini berada di garda terdepan penanganan COVID-19.
Salam Visio, salam sehat untuk kita semua. Bapak, Ibu, Saudara-saudara sekalian, pandemi COVID-19 sudah dan masih terjadi saat ini. Banyak pakar, tenaga kesehatan, masyarakat bersatu, berpadu, berusaha untuk menghadapi pandemi ini, termasuk di dalamnya fisioterapi. Muncul pertanyaan, apa bentuk dukungan dan peran fisioterapi dalam menghadapi pandemi ini? Fisioterapi senantiasa melakukan konsolidasi, koordinasi, sosialisasi, membuat surat edaran terkait bagaimana sejawat fisioterapi memberikan pelayanan di masa pandemi ini. Melakukan webinar, workshop, studi banding ke WCPT, ke Taiwan, ke Jepang pun telah dijalani. Membuat SOP guideline, manajemen pelayanan fisioterapi di masa pandemi. Mendorong setiap fisioterapis menjadi pelopor kampanye pencegahan penularan virus COVID-19 dan kampanye Exercise is Culture. Melakukan fund fisioterapi untuk negeri, kampanye di berbagai daerah, cabang, komisariat untuk menanggulangi dampak tertundanya layanan fisioterapi, mencegah meluasnya disabilitas, memburuknya gangguan gerak dan fungsi. Fisioterapi berperan aktif dan mendukung dalam kampanye vaksin COVID-19 saat ini. Vaksin telah hadir, MUI telah menyatakan halal, BP POM menyatakan aman. Mari terus berkontribusi dan melayani dengan berbagai inovasi. Meskipun bukan layanan emergensi, sesungguhnya layanan fisioterapi merupakan layanan esensi yang tidak bisa ditinggalkan di masa pandemi ini. Mari terus mengabdi, mari terus berkontribusi bagi negeri, bergerak, bermanfaat, bermartabat. Salam fisioterapi mengabdi untuk negeri.
www.pilihfisioterapi.com. Ketik lokasi, nama kota atau provinsi, Trenggalek. Oh, banyak ya fisioterapinya ya. Gimana ya? Ini aja deh. Oh, ada nomor teleponnya. WhatsApp juga bisa. Wow, ada mapnya juga. Aku buka lokasinya aja deh. Oh, tempatnya deket nih. Yaudah, aku mau kesana aja deh.
800 meter, belok kiri.
Agak cepetan dikit juga nggak apa-apa ya bang ya?
Iya mbak.
Tujuan Anda berada di sebelah kanan.
Anda sudah sampai di lokasi.
Alhamdulillah, udah sembuh, udah enak sekarang. Semudah itu ya ternyata pilih fisioterapi.
Pilih Physiotherapy.com adalah website yang didirikan oleh Ikatan Fisioterapi Indonesia untuk memudahkan masyarakat Indonesia menemukan fisioterapi di kotanya. Jika Anda membutuhkan fisioterapi, pilih Physiotherapy.com.
Introducing the newest Body Charger Recumbent Cross Trainer GB7006. This product uses a commercial-grade frame structure to make it durable for any user. It features a 20-inch oversized ergonomic seat that can make all users feel supremely comfortable during their exercise, with a reclining seat for effective back support. The GB7006 Recumbent Cross Trainer comes with a 90 to 180 degrees swivel seat, making entering and exiting safe and easy. The large supportive foot pedals and foot straps make the lower body supremely comfortable with less foot stress. The seat system is fully adjustable and can move forward and back with 14 different seating positions. The multi-position ergo grip handles makes it easy to find the proper shoulder length. The GB7006 provides natural stride motions. During the workout, the console displays various exercise information with 16 levels of resistance. The console features 18 exercise programs, including constant training. Want to save your results? Insert a USB flash drive. The GB7006 is a true low-step, through-designed product, allowing the elderly user easy entry, also integrated with a safety sturdy grab ring for convenience and support. The GB7006 features low starting resistance and an easily readable console. The low-impact workout can meet all of our users' standards, even for the elderly user. The GB7006 Recumbent Cross Trainer is a great product for a total body workout. Want to know more about this product? Visit Body Charger's official website and make an inquiry at www.bodychargerfitness.com. Introducing the newest Body Charger Recumbent Cross Trainer GB7006.
Each tube of Voltaren Emul Gel contains 0.2 grams diclofenac diethylammonium, calculated as diclofenac sodium, for the relief of mild to moderate pain in muscles, soft tissues and joints, and for symptomatic treatment of osteoarthritis. Voltaren Emul Gel is a combination of gel and cream for topical application, which enables penetration into the aqueous and lipophilic environment of the skin for relieving pain, reducing inflammation and swelling, and improving mobility. First, one must identify the specific pain point by assessing the affected area, such as muscles, soft tissues, or joints. Then one should apply Voltaren Emul Gel by squeezing 3 to 5 centimeters of Emul Gel to the affected area. Rub the product using a circular pattern. In vitro studies have proven that rubbing Voltaren Emul Gel for 45 seconds can increase diclofenac flux through the skin up to 5-fold at 8 hours. It allows Voltaren Emul Gel containing active ingredient diclofenac to penetrate deep into the skin to a depth of up to 1 centimeter. The first analgesic effect may occur 1 hour after application, as shown in a study for neck pain. Use Voltaren Emul Gel non-greasy formula 3 to 4 times a day. Voltaren Emul Gel is composed of a non-greasy formulation that combines gel and cream for topical application that enables penetration into the aqueous and lipophilic environment of the skin. The hydrogels within the gel base form a semi-permeable barrier that allows water evaporation, thus cooling and soothing and allowing penetration into the skin. When applied to the skin, diclofenac accumulates within the lipid component of the emulsion. The lipids then come into contact with the skin surface, where the active ingredient is released and enables penetration into the aqueous and lipophilic environment of the skin. Diclofenac accumulates in the skin, which acts as a reservoir from where there is a sustained release of drug into underlying tissues. Pain, such as that in muscles, soft tissues or joints, is caused by tissue damage, which induces the release of membrane phospholipids to activate the arachidonic cascade. Phospholipase A2 catalyzes the first step of the cascade, converting phospholipids into arachidonic acid, which can subsequently be oxidized by lipoxygenase to produce inflammatory leukotrienes. Additionally, COX-2 converts arachidonic acid into prostaglandins, which activate nociceptors and induces the feeling of pain. Diclofenac's main mode of action is reversible inhibition of the COX enzymes, with a selectivity for COX-2 over COX-1, which reduces prostaglandin synthesis and accounts for diclofenac's anti-inflammatory, antipyretic, and analgesic effects. Inhibition of the COX-2 protein decreases the production of prostaglandin. The first analgesic effect occurs approximately 1 hour after application, as shown in a study for neck pain. Diclofenac is also a potent inhibitor of phospholipase A2 activity. Evidence indicates that diclofenac also decreases the production of inflammatory leukotrienes. These additional processes may explain the high potency of diclofenac. Topical administration of Voltaren Emulgel results in low systemic exposure to its active ingredient, diclofenac diethylammonium, that is equivalent to 3 to 7% of the applied dose. Plasma levels are well below the range at which systemic adverse events usually occur. Voltaren Emulgel is specially formulated to deliver topical diclofenac diethylammonium to relieve soft tissue pain and reduce inflammation and swelling in painful conditions such as osteoarthritis.
Introducing the newest Body Charger Recumbent Cross Trainer GB7006. This product uses a commercial-grade frame structure to make it durable for any user. It features a 20-inch oversized ergonomic seat that can make all users feel supremely comfortable during their exercise, with a reclining seat for effective back support. The GB7006 recumbent cross trainer comes with a 90 to 180 degrees swivel seat, making entering and exiting safe and easy. The large supportive foot pedals and foot straps make the lower body supremely comfortable with less foot stress. The seat system is fully adjustable and can move forward and back with 14 different seating positions. The multi-position ergo grip handles makes it easy to find the proper shoulder length. The GB7006 provides natural stride motions. During the workout, the console displays various exercise information with 16 levels of resistance. The console features 18 exercise programs, including constant training. Want to save your results? Insert a USB flash drive. The GB7006 is a true low-step, through-designed product, allowing the elderly user easy entry, also integrated with a safety sturdy grab ring for convenience and support. The GB7006 features low starting resistance and an easily readable console. The low-impact workout can meet all of our users' standards, even for the elderly user. The GB7006 recumbent cross trainer is a great product for a total body workout. Want to know more about this product? Visit Body Charger's official website and make an inquiry at www.bodychargerfitness.com.
warahmatullahi wabarakatuh. Excellencies, distinguished guests, ladies and gentlemen, a very good afternoon and warm welcome to the beautiful and historical Yogyakarta Special Region. It is our utmost delight to welcoming you all today in this very special occasion, International Conference Physiotherapy 2021, with the theme, The New Challenges, Physiotherapy in New Order. We are very honored to welcoming our special guests joining us all the way live from several countries. We are extending a very good afternoon to the Minister of Health of Indonesia, Mr. Budi Gunadi Sadikin, the Honorable Chief Executive Officer of World Physiotherapy, Mr. Jonathan Cruz, the Honorable President of Indonesia Physiotherapy Association, Mr. Ali Imran. And also the most importantly, we also welcoming you all and a very good afternoon to all of the participants and international audiences, and also the President of Physiotherapy Association from Japan, Macau, Malaysia, Singapore, Philippines, and Afghan. To the international audience all around the world that participating and joining us through the online platform, both YouTube and Zoom. Welcome to our international conference today. We sincerely wishing that you are all here today with us, but due to the global pandemic that's still spreading high, we are going to want to keep everyone safe. We're sending a lot of love and hope everyone stays safe and healthy out there. Ladies and gentlemen, first of all, let me introduce myself and my partner here. I am Aprilia and my partner here, Mr. Gali, that would be your master of ceremony today. This ceremony would be containing with several sections as follows. First, opening. Second, singing Indonesian national anthem, and followed with the Indonesian Physiotherapy Association anthem. Third, welcome speech, and also to open the international conference. Next, the main agenda of the International Conference of Physiotherapy 2021, announcement of the competitions, and closing.
Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera untuk kita semuanya. Yang terhormat Menteri Kesehatan Republik Indonesia, Bapak Budi Gunadi Sadikin. Yang kami hormati CEO World Physiotherapy, Jonathan Kruger. Ketua Umum Ikatan Fisioterapi Indonesia, Bapak Muhammad Ali Imran. Dan yang berbahagia Bapak Ibu peserta International Conference yang hadir di tempat ini, Ballroom Sambisari Hotel Grand Ina Malioboro, Yogyakarta, Daerah Istimewa Yogyakarta, maupun hadirin yang mengikuti secara online. Puji syukur marilah senantiasa kita panjatkan kehadirat Tuhan Yang Maha Esa, karena atas limpahan berkah dan nikmatnya, kita semua dapat menghadiri acara yang luar biasa pada siang hari ini. Bapak Ibu hadirin yang berbahagia, izinkan kami Gali dan Aprilia untuk memandu acara International Conference Physiotherapy pada hari ini dari awal sampai akhir acara nanti. Sebelum acara kita mulai, izinkan kami membacakan susunan acara yang akan kita lalui pada hari ini. Acara yang pertama adalah pembukaan, dilanjutkan acara yang kedua, menyanyikan lagu kebangsaan Indonesia Raya, dilanjutkan Mars Ikatan Fisioterapi Indonesia. Acara yang ketiga, sambutan-sambutan. Acara yang keempat, acara inti International Conference Physiotherapy. Acara yang kelima, pengumuman pemenang lomba. Acara yang terakhir adalah penutup.
guests, ladies and gentlemen. We would like to start this conference today with a prayer. Respectfully, we invite to everyone to invoke to the Almighty for a while.
Hadirin yang berbahagia, acara yang pertama adalah pembukaan. Marilah acara International Conference Physiotherapy pada hari ini kita mulai bersama dengan berdoa menurut agama serta keyakinan kita masing-masing. Berdoa disilahkan.
Amin. Ladies and gentlemen, for a brief moment, we would like to invite you to sing Indonesian National Anthem, Indonesia Raya, that will be followed with Indonesian Physiotherapy Association Anthem.
Hadirin yang berbahagia, acara selanjutnya adalah menyanyikan lagu kebangsaan Indonesia Raya, dilanjutkan dengan Mars Ikatan Fisioterapi Indonesia. Kepada hadirin semuanya, diharapkan dengan sikap sempurna.
Fisioterapi Indonesia, majulah ayo maju, tunjukkan semangatmu demi fisioterapi Indonesia. Gerakan jiwa raga dan pengabdianmu untuk masyarakat Indonesia. Ikatan Fisioterapi Indonesia mengerti untuk bangsa kita. Obatkan semangat dan tugas mulia. Ikatan Fisioterapi Indonesia, obatkan semangat dan tugas mulia. Ikatan Fisioterapi Indonesia.
Thank you very much. Ladies and gentlemen, now we are going to have a welcome speech from our chairman of the committees, Mr. Sumargiono.
Hadirin yang berbahagia, acara selanjutnya adalah sambutan dari Ketua Panitia, Bapak Sumargiono.
To Mr. Sumargiono, the time is yours.
Kepada Bapak Sumargiono, kami persilakan.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua dan selamat siang. Yang terhormat Bapak Menteri Kesehatan Republik Indonesia, Bapak Budi Gunadi Sadikin, Excellency CEO of World Physiotherapy, Mr. Jonathan Kruger, Excellency President of Physiotherapy Association from Australia, Macau, Philippines, Singapore, Afghanistan, and Japan. Yang saya hormati dan saya banggakan, Bapak Ketua Umum Ikatan Fisioterapi Indonesia, Bapak Moh Ali Imron. Yang saya hormati dan saya banggakan juga, Bapak Wakil Ketua Umum Ikatan Fisioterapi Indonesia, Bapak Parmono Dwi Putro. Yang saya hormati dan saya banggakan, Bapak Sekretaris Jenderal Ikatan Fisioterapi Indonesia, Bapak Muhammad Irfan. Dan yang saya hormati dan saya banggakan seluruh peserta International Conference Physiotherapy. Yang pertama dan paling utama, marilah kita panjatkan puji syukur kehadirat Allah Subhanahu wa Ta'ala, Tuhan yang Maha Esa, karena atas segala kasih sayangnya, limpahan rahmatnya, sehingga kita bisa melaksanakan acara yang sangat membanggakan ini. Bapak Ibu, hadirin peserta Konferensi Internasional Fisioterapi, selaku Ketua Panitia, saya mengucapkan selamat datang dan selamat mengikuti Konferensi Internasional Fisioterapi ini yang kita lakukan melalui aplikasi Zoom. Hal ini terpaksa kita lakukan mengingat pandemi COVID-19 belum berakhir, sehingga kita tetap harus melaksanakan protokol kesehatan dengan kita melakukan kegiatan ini melalui Zoom. Mudah-mudahan ini tidak mengurangi makna dan esensinya, sehingga kita tetap bisa melaksanakan kegiatan ini dengan sebaik-baiknya. Bapak Ibu hadirin yang berbahagia, pelaksanaan atau penyelenggaraan konferensi internasional fisioterapi ini diharapkan akan memberikan banyak manfaat kepada kita semua. Karena dengan adanya acara ini kita akan bisa mengetahui berbagai macam regulasi baik di bidang pendidikan maupun di bidang pelayanan yang dilakukan di berbagai negara yang nanti akan disampaikan oleh para pembicara dari berbagai negara. Ini tentunya akan bisa menjadi masukan yang sangat berharga bagi kita semuanya. Bahkan kita harapkan nanti juga akan disampaikan berbagai modifikasi pelayanan kesehatan yang berkaitan dengan adanya pandemi COVID-19 ini. Sehingga kita harapkan ini akan bisa menjadi masukan yang sangat berharga bagi kita, sehingga kita bisa memberikan pelayanan yang sebaik-baiknya kepada masyarakat secara efektif, efisien, dan aman, baik bagi masyarakat sebagai penerima pelayanan kesehatan maupun kita sebagai pemberi pelayanan kesehatan. Bapak Ibu yang berbahagia, kami selaku panitia tentunya banyak kekurangan, kekhilafan, walaupun kami sudah berusaha semaksimal mungkin untuk memberikan yang terbaik. Tetapi kami hanya manusia biasa yang tentunya memiliki kelemahan dan kekhilafan. Selanjutnya, Bapak Ibu sekalian, kami mengucapkan selamat mengikuti acara konferensi internasional fisioterapi ini dari awal sampai akhir. Mudah-mudahan banyak hal yang bisa kita ambil dari acara ini. Semoga Allah Subhanahu wa Ta'ala, Tuhan yang Maha Esa, memberikan kemudahan, kelancaran, dan kesuksesan dalam acara ini. Terima kasih. Saya akhiri. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much. Ladies and gentlemen, now we are stepping forward to the next agenda, a welcome speech and also to open the International Conference Physiotherapy 2021 that will be directly delivered by the President of Physiotherapy Association Indonesia, Mr. Ali Imron.
Hadirin yang berbahagia, acara selanjutnya adalah sambutan dari Ketua Umum Ikatan Fisioterapi Indonesia, sekaligus berkenan membuka acara International Conference pada siang hari ini.
To Mr. Ali Imron, the time is yours.
Kepada Bapak Muhammad Ali Imron, disilahkan.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera buat kita semua. Yang terhormat Bapak Menteri Kesehatan Republik Indonesia, Bapak Budi Gunadi Sadikin, Excellency Chief Executive Officer of World Physiotherapy, Mr. Jonathan Kruger, all distinguished speaker, the President of Physical Therapy Association from Australia, Macau, Philippines, Singapore, Malaysia, Afghanistan, and Japan. Bapak Ibu, seluruh peserta International Conference Ikatan Fisioterapi Indonesia yang berbahagia. Good afternoon and welcome to the International Conference of Indonesian Physical Therapy Association 2021. Pertama dan yang paling utama, saya mengajak kepada Bapak Ibu sekalian untuk bersyukur kehadirat Tuhan yang Maha Kuasa, sehingga kita tetap diberikan kekuatan untuk bisa melaksanakan tugas-tugas kita kepada profesi, bangsa, dan negara. Ladies and gentlemen, Pandemic COVID-19 have been changed our life, our way to communication with others and our relationship. Pandemic bring us to the new challenges, physiotherapy and new order. Regarding to the condition, we need a new strategy to solve the problem. We can see that lockdown is the only option that can be selected to inhibit the spread of the virus. We watch on the television and also follow the social media updates that many cities that was originally very busy suddenly turned into the dead city, and nowadays second and third wave be a new challenges. All public services paralyzed and quality of life decrease. People feel worry of the life and today and the future. Through the unique competition, physiotherapy have strong ability to motivate and guide people live with healthy style, hand washing frequently, physical distancing, and regular exercises. As we know that evidence shown to us, exercises will increase our immunity. People ask when COVID-19 ends, and until now is uncertain. Stay-at-home policy causes access to physiotherapy services decline, and this condition can lead to increase of physical disabilities. For this reason, a professional organization need to formulate a strategy to make of our profession remain relevant. In this context, Indonesian Physical Therapy Association initiate this conference to learn from each other regarding the positive things that have been done by whole friendly countries to increase the role of physiotherapy, especially in COVID pandemic and in the future. The conference will prove the existence of great thinkers and relevant ideas and try to give an alternative path to provide answer, especially in physiotherapy science and profession, and to deliver a clear insight about what is the role of physiotherapy during and after this pandemic. Other concern in Indonesian Physical Therapy Association is how the people get the direct access for physical therapy services. That is a very important philosophy at the professional physiotherapy in Indonesia. In our experience, direct access improve the relationship between both patient and physiotherapists and makes collaboration with other healthcare providers much smoother and easier. We concern direct access because make it easier to receive care in timely fashion, reducing the risks associated with prolonged treatment of your condition. Ladies and gentlemen, on this occasion, on behalf of Indonesian Physical Therapy Association, I would like to thank all of you and many extraordinary people for their willingness to share knowledge of experiences with all of us today. And special thanks again for Minister of Health Republic of Indonesia, Mr. Budi Gunawan Sadikin, and also thank you very much for CEO World Physiotherapy, Mr. Jonathan Kruger, and thank you all to the committee that can lead the great team for the holding of the 2 days conference. In this good opportunity, I want to say goodbye as Indonesian Physical Therapy Association President, because leadership regeneration will soon take place through this Congress. Thank you for your continuing to support IPA and me as a president in the second period. I hope IPA will get better in the future. Last but not least, I would like to express my appreciation to all participants, and I hope you enjoy this conference. Ladies and gentlemen, before the end of my welcoming speech, allow me to read a very inspiring quote from French philosopher Yang Piaget. Only education is capable of saving our society from possible collapse, whether violent or gradual. With saying Bismillahirrahmanirrahim, this conference officially open.
Thank you very much for the inspiring speech from our President of Indonesian Physiotherapy Association, and also thank you very much for opening our international conference Physiotherapy today. Ladies and gentlemen, before we go to the main agenda today, there will be some information from our partnership that support us to make this event happen.
Kami aturkan banyak terima kasih kepada Bapak Muhammad Ali Imron yang telah menyampaikan sambutan sekaligus membuka acara International Conference Physiotherapy pada siang hari ini. Hadirin yang berbahagia, acara selanjutnya adalah acara inti International Conference. Namun sebelum acara inti kita mulai, akan ada beberapa informasi dari rekanan pendukung kegiatan kami.
Assalamualaikum warahmatullahi wabarakatuh. Pertama-tama, perkenalkan saya Asma Omar dari PT Bolt Technologies Leading Indonesia. Good afternoon, ladies and gentlemen. I would like to introduce myself. I am Asma Omar, product specialist from BTL Indonesia. We are very glad that we are able to join this very great and very achievable Congress from Vitafi. We would like that the Congress and the workshop will run very well. Pada kesempatan ini, perkenankan kami memperkenalkan salah satu produk dari PT BTL Indonesia, yaitu Hands Free Sono. Hands Free Sono adalah produk yang memungkinkan pengerjaan atau terapi ultrasound dilakukan secara independen oleh terapis. Produk Hands Free Sono seperti terlihat pada gambar adalah ini aplikator yang memungkinkan teman-teman fisioterapis untuk melaksanakan terapi ultrasound tanpa perlu memegang terus-menerus aplikator ultrasound, karena aplikator ini adalah aplikator smart, di mana value-nya untuk teman-teman fisioterapis, seperti yang kita ketahui sekarang pada era pandemi, kita di banyak keterbatasan yang ditimbulkan oleh pandemi ini. Salah satu keterbatasannya adalah keharusan untuk membatasi interaksi fisik atau kontak fisik. Nah, dengan Hands Free Sono, kita bisa meminimalisir kontak fisik antara fisioterapis dan pasien yang melakukan terapi ultrasound. Di sini kita bisa lihat, ini adalah Hands Free Sono. kita berikan ilustrasi. Ini adalah bagaimana cara kerja aplikator ultrasound konvensional, di mana aplikator harus dipegang dan digerakkan secara terus-menerus oleh fisioterapis. Sementara ini adalah hands-free sono. Kita bisa lihat bersama-sama gimana cara kerjanya. Hands-free sono ini akan memancarkan gelombang ultrasound secara bergantian dari masing-masing kristal yang terpasang. Karena adanya perpindahan pemancaran gelombang ultrasound, jadi aplikator ini dapat bekerja secara independen. Ini contoh pengaplikasiannya, bisa di kaki, bisa di tangan. Ini salah satu hasil pemindaian dari efektivitas terapi dengan hands-free sono, ultrasound kami bisa dilihat hasilnya tetap maksimal. Ini adalah contoh pengaplikasiannya. Ini adalah dua produk hands-free sono dari kami. Ada yang eranya atau efektif radiating areanya 12 cm persegi dan 18 cm persegi, tergantung pada kebutuhan rekan-rekan fisioterapis sekalian di lapangan. Ini adalah sedikit summary tentang produk hands-free sono kami. Produk ini adalah produk yang unik, kompatibel untuk produk BTL 4000 Smart Premium Ultrasound, di mana produk ini memungkinkan fisioterapis melakukan terapi ultrasound dengan penghematan waktu dan tenaga, dengan hasil efektif. Demikian presentasi dari kami mengenai hands-free sono. Harapan kami, rekan-rekan fisioterapis sekalian, selalu bersahabat dan selalu meletakkan mengingat BTL. Kami berharap kegiatan Titafi kali ini berjalan dengan lancar dan memberikan hasil maksimal kepada teman-teman fisioterapis yang mengikuti acara ini. We hope that this Congress, this activity will bring the maximum achievement and will give the best result for the participant. Also, we would like that the committee will run the Congress and the activity of Titafi successfully. Thank you for your kind attention. Terima kasih banyak atas perhatian peserta Titafi pada kesempatan ini. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Nama saya Dwiki dari PT Multi Destosa. Saya di sini ingin memperkenalkan sedikit alat kami dari PT Multindah, yaitu alat limpatas. Nah, saya share screen. Alat limpatas ini alat terobosan baru dari kita, yaitu menggunakan negative pressure meter. Alat ini tuh banyak membantu untuk kasus-kasus onkologi, ortopedik, sport terapi, neurologi, dan MSD. Alat ini sangat ergonomis dengan bentuk yang kecil dan tujuannya memang digunakan untuk dibawa kemana saja agar alat ini bisa diterapkan di area manapun. Alat ini juga dapat di-adjustable position-nya untuk pressure-nya dari 20 sampai 250 MHz. Nanti kita akan lihat di tampilan videonya. Terus alat ini sudah didukung dengan power supply for all day use yang akan bisa bertahan lama selama 8 jam penuh. Dan alat ini juga sudah ada treatment programnya. Berikut kita akan masuk ke videonya untuk melihat bagaimana sih fungsi dari limpatas itu sendiri. Ini adalah alat dari Limpatas. Alat ini sudah touchscreen. Dengan model yang compact, alat ini jauh lebih mudah untuk digunakan. Terdapat 5 cup untuk area-area yang berbeda. Pengaplikasiannya sangat mudah. Bisa untuk limfadema, swelling, dan scarring. Ini cara pengaplikasian dari negative pressure sendiri ini untuk mengekspand tisu yang ada di dalam tubuh kita. Dengan mengekspand memudahkan untuk metabolic waste-nya ini jauh lebih mudah untuk digerakkan. Alat ini pain free karena kita tidak menggunakan positive pressure, jadi tidak menekan ke bagian badan pasien, tapi kita menariknya dengan negative pressure seperti sistem cupping. Alat ini portable. Di dalam bag ini semua kita sudah bisa menyiapkan alatnya untuk dibawa kemana saja. Untuk alat Limpatas ini sendiri sudah ada beberapa kasus besar yang bisa dijalani, yaitu untuk rehabilitasi, bisa untuk edema manajemen, fibrosis, soft tissues. Untuk ortopedik sendiri bisa untuk sebelum operasi dan post operasi, untuk pain management juga karena alat ini pain free. Lalu untuk sport terapi, untuk swelling, untuk shin splint, untuk sprain juga bisa digunakan. Untuk aesthetic medicine, untuk beberapa kasus kita bisa menggunakan ini untuk kasus-kasus kecantikan. Mana sih perbedaan dari Limpatas itu sendiri dengan cupping, kita bisa lihat di sini. Alat ini bisa intermittent juga. Intermittent itu bisa kita atur, disesuaikan dengan kebutuhan dari treatment itu sendiri. Alat ini bisa mengeluarkan vibrasi dari 20 sampai 90 Hz. Alat ini bisa continuous juga, untuk ketekanan pressure-nya itu 20 sampai 350 mmHg untuk kasus-kasus sport therapy. Dari Limpatas sendiri ini kita mempunyai 4 teknik penggunaan, yaitu stationary technique, left hand twist, sliding technique, dan knitting technique. Dalam video berikutnya kita akan memperlihatkan sedikit bagaimana cara pengaplikasian teknis ini kepada pasien. Nah, untuk teknik stationary, kita seperti menggunakan ultrasound, jadi kita hanya menempatkan itu di satu posisi aja dan kita alihkan ke tempat lain setelah 3 sampai 5 kali aplikasian. Untuk left hand twist, dia ditarik seperti kita melakukan knitting kepada baju. Jadi untuk memudahkan dia memperlancar aliran limfademanya. Untuk proses sliding ini kita bisa dibantu dengan dengan krim atau mungkin baby oil hanya untuk memudahkan proses sliding itu sendiri. Ini tujuannya adalah mendirect fluidnya itu ke arah limpatik yang sehat. Untuk proses sliding ini kita tidak perlu menggunakan tenaga sama sekali karena negative pressure dari cupping itu sendiri yang akan menarik kulit dari pasiennya. Proses knitting sendiri ini menggabungkan proses sliding dan proses knitting yang di kedua tadi. Jadi untuk memudahkan terskari. Biasa digunakan dengan cupping-cupping kecil. Nah, demikian presentasi sedikit informasi dari alat baru lipat touch kami. Semoga informasi ini bermanfaat dan semoga acara pada hari ini dapat berjalan dengan baik sampai pada akhir acara. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera.
Lalu untuk maaf, slide-nya belum kelihatan Pak Andy. Oke, terima kasih. Sebelumnya, Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, Bapak Ibu, nama saya Gali. Saya di sini perwakilan dari farmasi GSK untuk produk Voltaren Emulgel. Terima kasih untuk waktu yang diberikan. Langsung saja di sini nanti saya akan sedikit menyampaikan untuk produk Voltaren Emulgel. Jadi untuk Voltaren Emulgel itu merupakan NSAID topikal, itu di mana indikasinya adalah untuk membantu meredakan nyeri dan peradangan. Nah, untuk yang slide ini merupakan bagaimana mekanisme terjadinya nyeri. Jadi ketika tubuh kita itu mengalami cedera, maka tubuh kita itu akan memproduksi enzim, yaitu yang namanya adalah enzim COX-2. Nah, enzim COX-2 itu yang akan membantu pembentukan prostaglandin. Nah, di mana prostaglandin adalah pemicu timbulnya rasa sakit atau inflamasi. Next. Nah, kemudian bagaimana sih cara kerja dari NSAID sendiri? Nah, cara kerja dari NSAID sendiri adalah itu membantu meredakan rasa sakit dengan cara menghalangi enzim COX-2 supaya prostaglandin tidak terbentuk dan akhirnya nyeri nanti tidak timbul. Next lagi. Nah, untuk dalam memilih suatu NSAID topikal itu ada 3P yang harus jadi pertimbangan kita. Yang pertama adalah potensi, kemudian yang kedua adalah penetrasi, kemudian P yang ketiga adalah pain free movement. Gitu. Next, Pak. Next. Bagaimana sih cara kita mengukur potensi? Next lagi. Untuk cara mengukur potensi itu ada yang namanya adalah EC50. EC50 itu adalah merefleksikan jumlah zat aktif yang dibutuhkan untuk bisa menghambat enzim COX-2 sebesar 50%. Jadi semakin kecil nilai EC50, otomatis zat aktif tersebut semakin poten. Nah, ini adalah nilai EC50 untuk beberapa NSAID topical. Jadi untuk voltaren yang muncul kita itu kandungan aktifnya diklofenak, nilai EC50-nya adalah 0,038, kemudian ada ketoprofen 2,9, ada ibuprofen 7,2. Nah, kalau dibandingin untuk diklofenak itu potensinya itu 190 kali lebih poten dibandingkan dengan ibuprofen. Next lagi. Nah, kemudian masuk ke P yang berikutnya adalah penetrasi. Penetrasi sih itu apa ya, penyerapan. Jadi untuk NSAID topika kan ada banyak formulasinya, nanti ada yang dalam bentuk krim, ada yang dalam bentuk gel. Kemudian next lagi ya. Jadi untuk voltaren kita itu formulasinya adalah emulgel, gabungan antara krim dan gel. Itu untuk gambar berikut tuh di sebelah kiri itu ada voltaren kita yang dalam formulasi emulgel. Kalau yang sebelah kanan itu adalah sama-sama kandungan diklofenak, cuma dia formulasinya adalah dalam bentuk gel. Di mana dari hasil penelitian itu untuk yang formulasi emulgel itu kandungan diklofenak yang terdapat dalam kulit itu 7 kali lebih banyak dibandingkan yang dalam bentuk gel. Next lagi. Kemudian masuk ke yang berikutnya adalah pain free movement. Bebas bergerak tanpa rasa sakit. Gitu. Next lagi. Jadi untuk pain free movement sendiri itu data penelitiannya itu ada yang namanya adalah NNT atau number need to treat, atau angka atau jumlah pasien yang diperlukan untuk mendapatkan efek pengobatan lengkap atau sempurna. Apabila nilai NNT semakin mendekati angka 1, maka dapat dikatakan pengobatan obat tersebut adalah semakin efektif. Next lagi. Nah, ini adalah nilai NNT untuk kita voltaren gel. Untuk nilai NNT kita adalah 1,8. Itu terpautnya cukup lumayan dibandingkan dengan ibuprofen gel yang di angka 3,9. Next lagi. Nah, itu adalah tadi sebelumnya adalah 3P yang kita jadikan pertimbangan dalam memilih suatu NSAID. Kemudian bagaimana ketika dikompar dengan yang topikal panas gitu. Next. Biasanya untuk topikal yang panas itu dia kandungannya adalah ada metisalisilat gitu. Di mana zat aktif tersebut adalah menyebabkan interaksi rasa panas untuk mengubah atau mengimbangi rasa nyeri pada otot gitu, dan menyebabkan kemerahan pada kulit dan melibatkan pembuluh darah yang memberikan perasaan hangat dan nyaman. Artinya obat dengan topikal panas ini hanya bekerja di permukaan gitu. Nah, jadi jelas ketika dikompar dengan produk kita voltaren emulgel yang jelas cara kerjanya itu dia adalah kandungan aktifnya adalah diklofenak, yang cara kerjanya adalah dia menghambat enzim COX-2 tadi supaya prostaglandin tidak terbentuk dan akhirnya nyeri tidak timbul gitu. Next lagi, Pak. Nah, bagaimana ketika dikompar dengan versus yang NSAID yang oral? Karena kan NSAID kan selain NSAID yang topikal ada NSAID yang oral. Jadi kekhawatiran terbesar dalam penggunaan oral NSAID adalah mengenai efek samping. Jadi biasanya kalau oral NSAID itu akan diserap ke seluruh tubuh. Kemudian kalau untuk yang topikal itu kan bisa lokal. Jadi untuk yang kalau kasusnya nyeri di banyak tempat, mungkin rekomend untuk yang NSAID oral. Tapi kalau kasusnya nyeri di beberapa titik, lebih rekomend untuk yang NSAID topikal untuk menghindari efek samping tadi. Next, ya, saya kira sih itu tadi untuk riset kita mengenai voltaren emulgel. Sekali lagi untuk terima kasih untuk waktunya, untuk kerjasamanya. Semoga bisa kerjasama lagi di lain waktu. Mohon maaf bila ada kekurangan. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
the presentation to all of the partnership. Well, we're without further ado, we're stepping forward to the main agenda that will be initiated with a keynote speech and followed with the panel presentations from several countries. This section will be guided by our moderator, Miss Faiza Abdullah.
Hadirin yang berbahagia, kami ucapkan terima kasih yang sebesar-besarnya kepada rekanan yang telah mendukung acara pada siang hari ini. Hadirin yang kami hormati, acara selanjutnya yaitu acara inti International Conference Physiotherapy pada hari ini. Untuk itu, kepada rekan kami Faizah Abdullah, kami persilahkan.
All right. Thank you, Mr. Gali and Ms. Aprilia. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. President of the Indonesian Physiotherapy Association, Mr. Ali Imron, distinguished speakers, ladies and gentlemen. My name is Faiza Abdullah. It's an honor for me to be the moderator and to welcome you to the International Conference of the Indonesian Physiotherapy Association 2021. As we all know, on 11 March 2020, WHO officially declared a global pandemic due to COVID-19. This situation has led governments and public health authorities worldwide to take several decisions on an emergency basis to slow down the rise of new cases of COVID-19 and to decrease the number of related deaths. In this scenario, this pandemic has greatly impacted the physiotherapy profession globally. The real challenge has been responding and understanding how to prepare workplaces and organize the clinical routines to receive potentially infected subjects. The physiotherapy community and the other professional healthcare providers have been called to optimize their clinical practice to face the COVID-19 diffusion. Most countries worldwide have seen COVID-19 cases, and many are experiencing outbreaks of the disease. Researchers and clinicians are trying to understand what the path to recovery may look like. This new disease has required health professionals to stop, reflect, and quickly adapt to the new order. And in today's conference, we will hear and learn from the leaders of the physiotherapy associations regarding the action that have been taken during the COVID-19 pandemic. But before that, we will hear a keynote speech delivered by CEO World Physiotherapy, Jonathan Kruger. Good morning, Jonathan.
Good morning.
Hi,
Selamat
how are
pagi.
you?
I'm
Selamat
good.
pagi.
The technology is working. I like this. It's great.
Yeah. How's UK, by the way?
It is cold and wet today. I wish I was in Indonesia where it would be, warm and sunny, I think.
Yes, it is. All right. Without further ado, time is yours.
Cool. Can I share my screen? Is that okay? I'll just...
Of course, of course.
Okay. So let me just... can you see my presentation?
Not yet. Probably in a minute.
Okay, just one moment. Now you can?
Right, yeah, there we go.
Perfect. Okay. So firstly, thank you very much for the opportunity to come and present to you today. And what I'd like to do is just talk through how World Physiotherapy has been supporting our member organisations through the COVID-19 pandemic. So as you mentioned in your introduction, the World Health Organization declared the pandemic. I had the date of the 12th of March, but you said the 11th of March, but it was over 1 year ago now. And I think that none of us would have thought 1 year ago what we could have achieved in the last year, and also what some of the challenges have been over the last year. So, you know, it's completely changed all our lives, and there's been a lot of suffering as a consequence of the COVID-19. And yeah, it's a time to pause and reflect and think about where we are now and how much work we still need to do to get over this. So what did World Physiotherapy do to respond to the COVID pandemic? We've done a whole series of activities, and I guess the best way to see what we've done is to go to our website. So the link is just there, but it's the COVID-19 information hub on our website. And on that website, we have lots of material, some of which we've produced, some of which have been produced by our member organisations, and some of this has been produced by our friends and colleagues and peer organisations such as the World Health Organization, etc. So there are briefing papers there, there are clinical practice resources, education resources, etc. One of the things we've also set up there is the COVID Physio Registry, just down the bottom of that list. And what we realised at the beginning of the pandemic was that there was a lot of people who were doing research into various aspects of COVID and physiotherapy. And what we wanted to do was to be able to capture that research so that people wouldn't repeat the research, so they could see who was doing research and they could make connections with those people. So if you're a researcher and you want to see what research is being done in other countries, then please go to the Physiotherapy Registry. And you can still, if you are doing research now, upload your information to the registry as well. The very first thing we did was to work with a group of physiotherapists, and initially from down in Australia, but then it expanded around the world, to get some physiotherapy management for the acute hospital setting. So again, what we realised was that this was a brand new area for physiotherapy, and we needed to make sure that everybody had the opportunity to have access to the best quality research that we could produce around how to manage patients with COVID. So this was published on the 25th of March. So within 2 weeks of the pandemic being announced by the World Health Organization. And we've worked with our member organisations to translate this into 26 different languages. And they've been downloaded from our website more than 16,000 times. And you can see here that the languages include Bahasa Indonesia. So, thank you to the translators and the people who worked very hard to translate that document, because we certainly couldn't do the work that we do if we didn't have those people supporting us to help to translate. So we also have it in Chinese, Spanish, French, Russian, and Arabic as well on our website. Another document which is on the website, which has been very valuable over this period of time, is a report that we had produced just before the pandemic on digital physiotherapy practice. So tele-rehab, tele-physiotherapy. And this was very fortunate that we had this document, and this has been very useful for member organisations and physiotherapists in countries to really have a look at how they can move from face-to-face physiotherapy to doing physiotherapy online. And so this provides some information and a framework for how that might occur. And this document has also been translated into many different languages as well. What we realised was that we needed some briefing papers as well. So the world was changing so quickly that we needed to be able to quickly produce a document that would give people some further information about a particular aspect of the pandemic. So some of the briefing papers that we've produced have been on topics like rehabilitation, how the pandemic has impacted on the university setting. So how did it impact on students and the way that they were taught? How did it impact on students' mental health? How did it impact on people's ability to get registered after they graduated, etc.? So these were some issues where we brought people together internationally so that we could do a briefing paper that essentially shows how this has been impacted around the world. We also did a paper there in September, which was on vulnerable communities and fragile health systems. So we realised that in high resource countries that there is a health system which generally has been able to cope with the pandemic. But increasingly, as you move down into lower resource settings and in some rural communities, etc., that the impact on COVID has been far greater because the general health system that exists in those places is a lot worse. So, or a lot less developed, I should say. So being able to put a highlight on some of those things has been a key part of what we've been able to do at World Physiotherapy. I mentioned just before that education has been a particular focus over the last year, and World Physiotherapy convened an education task force to bring together educators from all around the world to discuss and to consider, how is COVID-19 changing education? So as everybody's aware, physiotherapy is a very physical, it's a very touching profession, and suddenly the key part of what defines us has been taken away. So our ability to touch other people. So for students, we were really interested in seeing, well, how are we changing education? So how is practice changing, and how are we looking after the students to make sure that they can get all the training that they need and they're able to graduate and start practicing as physiotherapists. So we have all this information on our website, and if you want to go and have a look, then you're more than welcome to go and have a look there. But the Indonesian Association, like many associations, you've also done some work with your website. So here is the information page for physiotherapists around COVID-19 on the IFI web page, and most of our member organisations have some form of information here, and it's great that the link to World Physiotherapy's hub is on this page as well. For me, what I think is interesting is how different countries approach this. So I'm interested in the WhatsApp Centre, the squad for COVID-19. So obviously in Indonesia, that's been a good way of you to connect and to keep people up to date with the information that they need for COVID. And that's great that this is it's a unique way in which Indonesia has dealt with this situation. I know that some other countries, other member organisations use other forms of social media, such as Facebook or LinkedIn to try and Twitter to keep their members informed. So it's kind of interesting how this is a time of real challenge, but it's also a time of innovation, and it's really interesting to see the various types of innovations that have come out. So congratulations to the Indonesian Association for trying different things and being able to support your members during this time. One of the key parts of the activities that we do at World Physiotherapy is to support our member organisations, and this is true during normal times. It's also true during definitely during the past 12 months, where I would say I've done more support for member organisations to try and advocate on behalf of their members than at any other time. So this advocacy has been on individual issues with countries, such as trying to get access to tele-rehabilitation, for example. So in some countries, the law prevented physiotherapists from being able to do tele-rehab, to do online consultations. And so by working with member organisations, such as those organisations in Poland, for example, and in Spain, we've been able to get the law changed, which has allowed them to be able to continue to practice physiotherapy. There's also been advocacy to support physiotherapists to allow them to vaccinate, and I might talk about that a little bit later. I know that everybody is aware in the beginning how difficult it was to get personal protective equipment, so PPE. There was a global shortage, and there were issues with the logistics in terms of how we can get PPE to clinicians around the world. And again, one of the advocacy issues that we had to try and deal with was to explain that physiotherapists were frontline health professionals who needed to be protected at their workplace. So we started doing some advocacy and some support for individual member organisations. But increasingly we realised that this was a global issue, and this was a campaign that we should be able to take around the world. So we launched our PPE for PT campaign, and this was great success to do a few things. One was to demonstrate the value that physiotherapists have in the rehabilitation of patients with COVID, to make sure that health ministers were aware that physiotherapists were an important part of the health system, and that we needed to be protected as well. And to also show, I guess, our member organisations around the world that we were in solidarity with them and that we were trying to help them. So all the material for this campaign is still up on our website, although the issue in most parts of the world has got substantially better since May last year when we launched this. But there are a lot of material that is up there, and they're available in English, Spanish and French, and a few other languages where member organisations have worked with us to translate them. But here's some campaign materials that we used, some fact sheets to really help people. And these fact sheets were used within hospitals to take to hospital administrators to show them that physiotherapists needed to be protected in the workplace as well. So I'm very proud of this campaign because I think that it demonstrates the value of having a global organisation that can look after all of the physiotherapists around the world. Because for many member organisations, they lack the capacity, they lack the resources to be able to put together materials like this. The biggest issue that we're currently facing from an advocacy perspective is around vaccine equity. So I I admit that I'm incredibly fortunate to live in a country where we have a national health system here in the United Kingdom, which has rolled out vaccines to almost all adults over the age of 30. So 70%, as of yesterday, of adults in the United Kingdom have had at least one vaccination. However, I recognise that I come from a position of intense privilege in that regards, and that for many member organisations, many countries around the world, that they don't have this privilege. And so World Physiotherapy has been very vocal in advocating with the World Health Organization to have a more equitable system for distributing vaccines around the world. So we're part of the vaccine equity, we've signed the vaccine equity declaration. And last week we, I guess, pushed things even further by saying that we would support a waiver on vaccine patents. So essentially what we're saying is that this is a global health crisis that requires some flexibility in relation to patents. And if this is a way in which we can see more vaccines distributed, produced around the world, then this is something that we wholeheartedly support. Because we believe that the longer it takes to vaccinate everybody, then the greater risk to all of us. And so collectively, this isn't something that rich countries can just do and ignore some of the lower resource countries. We're all in this together, and we need to make sure that we continue to provide a voice for those countries and member organisations and physiotherapists that perhaps don't have a stronger voice in this discussion. So COVID-19 has caused a lot of challenges around the world, and I'd just like to play very briefly here a short video which is some physiotherapists from around the world talking about the impact of COVID.
I'm sorry to interrupt, Jonathan, but
yes,
it happens to, we're not able to hear the voice. Maybe you can raise the volume or...
Sure.
Yeah.
Is that...
It's still...
You can hear or you can't hear?
We cannot hear the voice.
Nothing at all, or it's just very soft?
Nothing at all, unfortunately.
So there's no sound at all? Because I can hear the sound.
Oh, it's strange.
Okay.
We have some clue from the media. It says that when you share the screen, you have to checklist the share sound.
Okay. So where is the checklist for sound? Why don't I stop share and then I'll go back?
Yes.
Share sound. Okay. Now we'll be good. Okay. I'll just...
In March 1 year ago, we set the physiotherapists
Yes.
You have to close your private practice.
Many of Polish private practices were locked for 1 month.
We didn't have masks. We didn't have what we need to protect ourselves and to protect our patients.
Our profession needs a lot of skills and touches. So how can you teach a skill if it's done online? So it's really difficult.
It was hard to introduce physiotherapy as an integral part of a treatment of patients with COVID.
That was at the beginning. And then after, we knew that it was really difficult for patients not to have their physiotherapist taking care of them.
Started with PPE with a lot of risk and scared, but now I think so all of them are champion in treating COVID patients.
We are pushing through it. We are taking all the precautions. In many clinics at local level, the physiotherapists, they wear PPE kits and go do the treatment.
It was an opportunity for us to train our faculty members how to use these digital tools.
Our chamber produced a lot of materials for patients, especially for elderly people and, for example, home-based working people. So we produced series of movies for patients so they can train by themselves.
And providing them the physiotherapy session by sending them an image or videos for the exercise by using of social media and WhatsApp.
Now we can do rehabilitation, telehealth in France, which is fully reimbursed for our patients.
It was very successful, really, because we are in connecting with the patient, don't leave them in their home suffering from the disability or suffering from the complication of fracture.
Society noticed that physiotherapy is very important for COVID survivors. Physiotherapy is introduced in all COVID hospitals now, all over in Poland.
Our hospital was the first one to realize the importance of physiotherapy, and they wanted every patient to be taking breathing exercises. Then as they were better, exercises, mobility, proning, all was done by the physiotherapist.
We have very successful experience in Gaza Strip to use or to engage physiotherapy services for the COVID-19 patient. We are reducing the dependency on the oxygen, which was the major problem for the decision maker here.
We work a lot with the government. Every week I work with the Ministry of Health, and now physiotherapists in France can test people.
Polish government media also picked up those ideas, and our materials are included and present on the official government web pages.
All the experts, all the specialists in COVID realized the important role of physiotherapy.
This pandemic has taught us a lot of things, and it made us very creative and innovative on how we can move forward with our profession.
So that was just a bit of a snapshot of how COVID has impacted physiotherapists around the world. And for World Physiotherapy Day last year, we obviously had a big focus on COVID and rehabilitation. And one of the great ways in which the world comes together around World Physiotherapy Day is through the translation of our materials. And so last year, we had 48 different languages, 18 of the world's top 20 languages we had materials in, and we had over 20,000 downloads of the material. And they included Bahasa Indonesia. So again, thank you for the physiotherapists who helped us to translate these documents. And again, they're available on our website if you need to access these. And although they were created for World Physiotherapy Day, they certainly can be used in other times as well. So for example, the resource on the left would be very useful if you were trying to set up telehealth, telerehabilitation in your province, in your state. And to continue on this year, we're now going to shift to the longer term rehab needs of people with COVID. And so the theme for World Physiotherapy Day this year is the role of is physiotherapy and long COVID. And we've been working with a number of groups. So there's a long COVID physiotherapy group, and also our work with the World Health Organization to try and make sure that long COVID is recognised as a significant long-term consequence of COVID. And this is where I think there is an opportunity for physiotherapists to demonstrate the value of what we do, because saving lives is obviously something which the doctors and nurses do very well, but actually giving people back their life through rehabilitation is something that physiotherapists do very well. And so we need to make sure that people recognise us for the skills that we have in this area. And I think that on World Physiotherapy Day this year, it will be a great opportunity to do that. And I think that this will lead to opportunities for the physiotherapy profession to potentially have a greater presence within health systems, because if we don't rehabilitate people with long COVID, then they're going to be lost. And I think that would be a great disappointment. So just to start to sum up, what we've seen here is that I think there has been an incredibly rapid change over the last 12 months in what it means to be a physiotherapist because of COVID-19. So we've seen systems unlock. So we've seen the start of digital practice, telerehabilitation. We've seen changes to the scope of practice, so working more remotely, but also some changes such as being able to vaccinate. And in some countries, because of the way in which the health system was set up, this has been a time where they've actually started to gain more capacity for direct access. So no longer having to work under the direction of doctors, but rather to have greater degrees of autonomy, etc. And some of these aspects are captured in a report that's on our website about the impact of COVID-19 on the physiotherapy services globally. And just to sort of finish off, what is absolutely clear is that over the last year, there has been an incredible disruption to physiotherapy. So where you are in the Asia Western Pacific region, 85% of our member organisations described a substantial disruption to physiotherapy services. And when you look at the various components of it, almost nothing has been untouched. So in private practice, in the public sector, in communities, and also in nursing home and aged care facilities, we've seen intense disruption around the world, and particularly that yellow bar in the Asia West Pacific region where Indonesia is situated. But the flip side of disruption is innovation. And so I think we shouldn't lose sight of the fact that we have made some gains this year. And these include the right of physiotherapists to give vaccinations. So France, Poland, here in the United Kingdom and New Zealand, and potentially other places in the world as well. And also, as we've spoken about earlier, so telerehabilitation services. So a year ago, this was not a part of physiotherapy practice, but now we've seen that 75% of our member organisations that reporting that physios are now able to provide some form of telehealth services. So I think that is a fantastic change in a very short period of time. So that's my presentation for this morning. Terima kasih, thank you very much for the opportunity to present, and happy to take questions or happy just to allow you to move on with the remainder of your conference. So thank you once again.
Thank you very much, Jonathan. Now we come to question and answer session. I'm going to start off with 1 or 2 questions from the audience.
Sure.
Yeah, the audience may use the raise hand feature, or you can just type it on the chat box. And for the warm up, I would like to invite Mr. Ahmad Shakib to deliver the question.
Okay, thank you, Faiza. Thank you, Jonathan.
My pleasure.
Thank you for the explanation about the role of physiotherapy in COVID. And then maybe the same situation between your country and Indonesia also. We have, you said that all of us has a lot of challenges how to give services to to our patient. Me also, because I'm a clinical practice, and then I have many problems how to increase the amount of the patient to come to our clinic. This is very hard for us because we face decrease maybe more than 50% visiting, and then we have to looking for the good strategy how to invite the patient, how to give a good services. You said that around 75% the ward physiotherapist member who has a who permit to get to permit to give telephysiotherapy, and then I don't know exactly the effectiveness to use the telephysiotherapy because we have many specific intervention, and then how to uh, uh, increase the effectivity to give physiotherapy with the telephysiotherapy. Uh, uh, yeah, according to your experience. Okay, thank you, Mr. Joranto.
Thank you. I think not every patient problem will work with tele-rehab, telehealth. So that is clear that sometimes you do need to see patients, and sometimes you do need to be able to touch the patient. I guess the challenge for us as physiotherapists is to see what can we do without being in the same room with a patient. And I think the evidence is for some conditions that some advice, watching them do their exercises in front and giving them information about how to change their exercises is appropriate. In some countries, patients have actually really liked that. And then in other countries, patients haven't liked that. And I guess it depends. There is some culture issues that go on. So sometimes people, the culture for patients is to be attached to a machine and to be touched by a physiotherapist. And if they don't get touched, then they feel that they are not getting a proper treatment. But I think that is the challenge. Over the last year, the services have gone down, as you said, 50%. And I think the challenge now is, for example, with long COVID, how do you make sure that physiotherapy is the people that look after long COVID in Indonesia? And I think World Physiotherapy Day is a good chance to do that, because let's try and increase the demand for physiotherapy services by describing how good we are at managing patients with long COVID, for example.
Okay, and then one more question. Okay, now in Indonesia situation is not many patient who we will give information only because there are many rehabilitation patient stage, and then we have to give directly intervention. But for the prevention and promoting only, we can give information. But for the rehabilitation intervention, I think it's very difficult for us to give intervention. And maybe this is the differences between your country and Indonesia. Maybe for the next, we will change in the situation.
Yeah, look,
And
I think
I need your experience about that.
Yeah, look, as I said, it's the context in which you practice physiotherapy is important. So we know that, for example, some health insurers will only pay you if you have been in the same room with a physiotherapist, and so with a patient. So there are some aspects which will be unique to Indonesia that just won't work, and part of that is the financing, part of that is the culture, part of that is just the general practice, etc. So, but I think what we've seen over the last year, I think, is that practice can change very quickly, and I think it's important for all of us to make sure that we are evidence-based, that we pay attention to, if there is evidence that we can do an intervention remotely, then I think that is something that we can do. But if we can't, then we've got to admit that we need to see the patient in the clinic. So I think that it's an evolution, and it's not one or the other. It's a combination, I think.
Yeah. Okay. I see. Okay, thank you, Mr. Jonathan.
Terima kasih.
Nice explanation. Terima kasih.
Very well. We have one more participant who would like to speak to Jonathan. Mr. Rizal, you may unmute your microphone.
Yeah. Good afternoon, Jonathan. Actually, we are in the afternoon time. Maybe you are in the morning.
It is the morning. Yeah.
Yeah. Recently, I am in Taiwan. I'm doing my PhD program at NTU for orthopedic physical therapy. The topic is really interesting, related to the telephysiotherapy, because I have also one experience when I did a short course in Canada, and we actually learned how to conduct something like assessment through the telephysical therapy to the rural area. The problem is, the biggest problem in Indonesia is we are consist of 70,000 islands. So we have many islands, and we have also many islands in the rural area without high technology. So actually, that is one of the biggest challenges for us to apply the telephysiotherapy in our back home. So do you have any reference how to face the barriers? And the second one, in Canada, as I saw, when they try to apply the physical therapy, they have something like apps or program that they have to apply in their clinic or in the hospital, so they can easily to conduct something like assessment. So they have a form that patient or client can fill directly, so we can get some private information for the client. Is it also happen in your country? So maybe you can share with us. Thank you.
Okay, so the first question around the barrier to participation because of infrastructure. So I live here in the United Kingdom now, but originally I was from Australia. So I understand rural technology, big distances, and the challenges of not having the right infrastructure to be able to do tele-rehab. So do I have a solution to internet access on small islands in Indonesia? No, but I think that we all realize that is a limiting factor, and so I think that this is where there are opportunities for innovation. So does it work to have fly in, fly out physiotherapy? So could you do a visit and run a clinic for a week, and then, you know, it might, tele rehab we kind of think is more like this, where there's a video screen, but it can be on the phone. So if I've seen a patient, and then, or it could be WhatsApp messages, you know,
exactly.
like there are some privacy issues and there are some issues around confidentiality, but, you know, maybe there is a Indonesian solution to how you could better support physiotherapy services in remote islands in Indonesia. And I'd be fascinated to hear, you know, what you might come up with, which could work to try and get more services across the country. In terms of your second question around, you know, the sort of like the interface, so the program that you use.
The program,
yeah. So on our website, we have some information about in the digital space. So how you would go about setting up a digital physiotherapy practice if it's possible. So it's like, it talks about, you know, client confidentiality, how you set up the video screens, but also how you share information. But again, you know, I think that sometimes there are ways in which you can put a few things together and it works as one. So, you know, if somebody does a voice message and sends it to you on WhatsApp, or they you know, take pictures of themselves, or they fill out a form, there are different ways in which you could do that. So I think it's interesting how sometimes the opportunity of a time like a pandemic forces us to be a bit more innovative.
Actually, this is about our weakness, especially in our country usually, because we cannot realize actually how to document our clinical report. So sometimes it will be better if through the physical therapy intervention, we have something like a program which is really directly to save our assessment or our services to the client. So that is probably, it will be better if we have something like program or application that patient also can how to say doing by themselves. So we can also reduce our interaction with the client actually.
Yeah, and I think that there are systems which people have designed where, for example, the physiotherapist does the exercises. When the patient finishes the exercises, they can
that's right.
And you know, there are some high-tech ways in which, you know, people can monitor how, you know, with Apple Watches and different things. Like there's some interesting ways in which technology has been used, and I think it's an exciting space.
Okay. Thank you, Jonathan.
Thank you.
All right, thank you very much, Mr. Rizal, and thank you very much, Jonathan. What an interesting discussion. I remember in the World Physio Congress, there was also a discussion related to the leadership during the pandemic, and it was very insightful session and always be an interesting issue to discuss. But we're almost out of time. So in 30 seconds, what is the main message that you would like the audience to take away?
So I think the message is that Indonesia is part of a global family of physiotherapists, and we are all here to work together, and that World Physiotherapy is a hub for all the different parts to come together. So I'd like to thank the Indonesian Association for inviting me to come today. Faisal, thank you very much for your beautiful introduction. The first country I ever went to when I first left Australia was to Indonesia, and as a 16-year-old I went on a school trip to Bandung. So I have very fond memories of Indonesia. It's a place that I hold very dear to my heart. So this is virtual for today, but I hope that sometime in the future I'll be able to come and meet with you face to face, and because I would love to hear more about how physiotherapy works in Indonesia and how we can collaborate together to try and improve the way in which physiotherapy operates in Indonesia. So thank you once again for the invitation, and yeah.
Thank you, Jonathan. We would like to meet you in person, hopefully soon after the
Thank
pandemic.
you. I hope so.
Yeah. On the behalf of the Indonesian Physiotherapy Association, thank you very much once again for joining and sharing with us. We really do appreciate it. Have a good
My
day,
pleasure.
Jonathan.
Thank you. Bye-bye.
Bye. All right, moving forward, we will have a two-panel session. And in this very first session, already joining with us, President of the Australian Physiotherapy Association, Mr. Scott Willis. Good afternoon. How are you?
I'm very good, thank you. And yourself?
I'm good, thank you very much. Also, we have President of the Japanese Physical Therapy Association, Mr. Kazuto Handa. President of the Singapore Physiotherapy Association, Ms. Sin Yi Lee. How are you? And we also have President of the Macau Physical Therapists Association, Ms. Kitman Au. Before we get started, I would like to go over a few items. The session will last for about 1 hour with a 10 to 15 minutes lecture from each speaker, followed by 20 minutes of the Q&A session. The participant will have the opportunity to submit questions into the chat box. You may send in your question at any time during the presentation. We will collect these and address them during the Q&A session at the end of the panelist presentation. If you would like a specific panelist to answer the questions, please mention the panelist name first, then the questions, then the context. During the session, keep your microphone on mute mode, and if possible, turn on the camera. Now it is time to hear the presentation which the panelists will deliver. Our first presenter is Mr. Scott Willis.
Thank you. I'll just bring up my presentation for you. There we go. You can see that.
Yes.
Okay, thank you very much for the invitation to come and talk to the Indonesian Physiotherapy Association. It's an honour and a privilege to be here tonight, or tonight here in Australia. I'm down here in Tasmania, in the little island on the bottom of the map of Australia. So it's about 6:15 here at night. So I thought I'd just give you a bit of a state of the play of what's happening around Australia at the moment. And as you can see from the current stats that was delivered today by the federal government, is we've had about 29,900 cases of COVID, and of those about 910 deaths. And about 121 still of active cases, but we haven't really had much community transfer. Those have been from returning overseas travellers at the moment. And if you look at the map below hand, it just splits out all the cases and all the deaths that are in the brackets of all the different states within Australia. And if you have a look at Tasmania all the way down the bottom, the 234, I'm one of those. I actually tested positive to COVID-19 back in May. But I'm recovering now. I've still got a few little symptoms, but I'm still part of that statistic. And as you can see within the cases of the age group and sex, you can see here in Australia about the age group between 20 and 29-year-olds, where you see the peak, and then it teeters off as you get up to the 18, 89-year-olds. But again, I don't think this surprises us. So the deaths that we're seeing here in Australia was around that 80 to 89-year-old age bracket. So more of our aged and aged care facilities were seeing where majority of our deaths were occurring, where not too many of our younger generation were dying of COVID, but still had the effects of the COVID-19 symptoms. And here in Australia, if you have a look at when we had the infections that really peaked, and where it was around the end of March and early April, where we had our first wave. And that's where we had it down here in Tasmania, but also in a few other different states around Australia. And we really went into our first lockdown. Here in Tasmania, we had probably our first lockdown. Our local hospital was closed down and deep cleaned, and actually had the armed guards of the federal armed forces come into our hospital and take control of that hospital to deem it safe again to resume as a hospital. And then again, our second wave, where it came, was around the end of July to the end of August. And we saw this mainly in Victoria, where they had a huge spike and they had some really significant lockdown issues around that area. And now we've tapered off right through to the current days, where we're really only seeing one or two cases that are coming through at the moment. So really those dates are end of March and early April right through, and then again the second wave of end of July to the end of August. This little slide here just demonstrates of our daily infection of people around that area with our spikes, but then also the daily that have been recovered as well. So you can see that there was a delay of the recovery, which you would expect post-COVID-19. And you can see right at the end there where the 21st of April and the 1st of May and 11th of May, we've just had a few little spikes there. And the government's been really, really clear and concise and shutting down our borders whenever we have any type of even one or two testing positive within those states, so that we don't get another spike and another wave coming through like we did earlier last year. So in terms of physiotherapy, what did we see with physiotherapy? What we saw was there was a significant increase in cancellations of patients coming into our clinics. And this was around the May 2020 survey that the Australian Physiotherapy Association did. And they found that around 43% of appointments were being cancelled by patients because of, one, the lockdown, but also just the risk to the patient, but also the risk to the clinic and the organisations that the physiotherapists work in as well. And if you look at our next wave around the August, we still saw that most of our businesses were still open. So we saw about a 99% of our business still maintained that they were still open. The ones that weren't, we found, were in the major cities or the major capital cities of Australia, where the lockdown and there was hardly anyone in those areas because it was our central business district. So those people would stay at home and work from home. So those businesses were the ones that really suffered and closed. And then if you have a look at what happened with our employees within our clinics, you could see that there was a significant, now if you have a look at the light blue parts of the graph, they were the Victorian practices, and this is when Victoria was at its peak. And you can see the Victorians really significantly reduced their work hours, or the employees' work hours, compared to the rest of Australia. But still, there was a significant amount of reduction in our employees' time at work, mainly because of the workload. that significantly reduced as well. And this really just gives us an idea of our service demand. And this again was a survey commissioned by the Australian Physiotherapy Association with our members, just trying to get a feel and a vibe of what's happening out there in the practice. And you can see the June service demand right through to July and then August. And you can see in August, the reduction in the demand was anything up to about 80%, which is a significant reduction for a private practice in an area such as Victoria. So they reduced, but what we're finding is post the reduction is when people started to get the confidence back, when the government reduced some of the restrictions, the rebound of patients coming back to their physiotherapists and resuming their rehabilitation significantly increased. And what we're seeing now that is increasing even significantly more and more. So what we could probably look to the future, and if we did have to go through another lockdown, I think we could confidently say that it would rebound again afterwards because of the first two lockdowns that we've been through. Jonathan spoke about having access to the personal protective equipment, and we're quite lucky here in Australia. And this was evident with our survey as well, that a significant amount of people, especially in the Victoria lockdowns, 84 to 85% actually had some good access to PPE. Where we're quite fortunate. The problem was that it was harder and harder as the lockdowns went on, as people started to try and get more and more PPE just in case it went on and on. But now overall, we had some pretty good access to the PPE that required, such as masks, gloves, and face shields. I also heard that Jonathan was talking a little bit about telehealth or telephysiotherapy, and here in Australia, with the lockdowns, there was before the lockdowns, telehealth wasn't actually funded by any private health insurer, any funder for physiotherapy. But within weeks of our lockdowns, we had telehealth actually funded by majority of our funding mechanisms here in Australia. So you can see that this was a catalyst and an opportunity for the physiotherapists to actually embrace what we feel that telehealth could actually value add to the system, especially in a rural area, or like some of your participants were saying earlier, out in some of the islands that required to continue their physiotherapy care and treatment. So we found that about 8 out of 10 practices offered some type of telehealth. And I agree with some of your participants, it's not for everything, but our current research is actually demonstrating the majority of our service delivery can be delivered for physiotherapy via telehealth. It just depends on what the consumer really wants and the demand for it from the consumer. But the studies are demonstrating that, if anything, the telehealth is as equivalent as in face-to-face provision of care. And this is one of the Facebook and Instagram posts that the Physiotherapy Association actually put out with the benefits of telehealth, trying to promote it and try and demonstrate the worth and value to the consumer. So some of the responses to the COVID-19 that we saw over the last 18 months or 12 to 18 months is that for the Australian Physiotherapy Association, we opened our hours for our members longer, mainly to try and give them the support that they required, because sometimes we're finding that members needed some of the information outside of hours. So we increased those offerings. We also offered all our members the employee assistance programs, because some of the members were going through some really tough and hard times. So we gave them some really some support, and that they could actually talk to some counsellors to work through some of the issues that they were experiencing. We offered our members some member discounts through our partners, so some of our corporate partners around Australia. Also, we distributed all the information that the government would give out. So we made sure that our members were up to date and got the information that they required in a timely manner, so that they could actually make a business decision whether they could continue on treating and what PPE they required. We really strongly advocated to all our state and federal ministers, aiming to get them to assist us to make sure that we could still open our services or open our doors to provide the service to the consumer. We really established a coronavirus resource page on our website with daily updates so that our members could access it and make sure that they were complying with anything that the government or the restrictions the government were applying to us. We did our member surveys to ensure that we were doing the right thing and anything else that we required as well. And we also offered some financial hardship, reduced membership fees for the people that were really finding it difficult and tough. We introduced an early bird discount for our 2021, so just to secure our membership and have an idea if we were going to have our membership still rejoin from the following year in 2021. We advocated for practice support funding through the government to ensure that the physiotherapists had that access to the support that they required and any funding mechanisms that were offered by the federal and state governments. And most practices, like I said before, are back to normal or significantly improved their numbers. We're finding a different patient cohort and really they're starting to come back in droves. We partnered with the government. So what we found as the first wave is that our governments were starting to think that if COVID-19 really took off here in Australia, like it did earlier in Europe and in the UK and the US, that we thought that we weren't going to have enough physiotherapists to actually go into intensive care units and provide that service. So we actually upskilled about 6,000 physiotherapists within 1 weekend to be competent enough to deliver the services within ICU, which is a huge feat by the Physiotherapy Association. We went to online for our professional development instead of the face-to-face, and we really lobbied for the telehealth funding by our insurers and government, which has now just been extended to the end of this year, which will be reviewed again and hopefully it will continue to be funded continuously forever. And we're constantly in that advocacy to the government and the physio world to really push our physio issues and what problems and issues that we're having. So in terms of our caseload, what did we see during COVID and post-COVID? So what we've tended to find more overuse injuries post-lockdowns because people are starting to come back and starting to get their sport back into action, or they started to exercise a little bit more because it was the only way that they could actually get outside. That was the only way that the government would allow them to come outside, is if they were exercising. We also saw more running and walking injuries because of that, and people were starting just to take up a little bit more of this recreation. From an occupational health and safety part of physiotherapy, there was no access to a lot of the workplaces, so we had to actually start looking at different ways we delivered it, such as telephysiotherapy. And now we're seeing, we treated the COVID patients. Now we're seeing a few people coming through with long COVID as well. And you know, I'm one of those. I still have a few little issues with fatigue and malaise. So we're still working through those long COVID patients post-COVID lockdowns. And in our aged care facilities, we're really looking and seeing that there was a lot of deconditioning with our aged care residents and in our nursing homes in older Australia. And so we're really seeing a lot of people seeking physiotherapy advice to increase their conditioning post-COVID. There was a lot of working from home injuries. So people were setting up home offices with laptops and things like that that weren't ergonomically sound. So we were finding that a few people were coming into our clinics post-COVID as well because of these injuries that they were experiencing. And as I said before, the clinic hours and staff after lockdown has been increased. So we're really finding that the service delivery is starting to really increase and get back to near normal or even more. And we're looking at that a lot of consumers are starting to look at us for exercise and fitness advice as well. So we're really starting to see that people are seeking physiotherapists to get this advice, which is really encouraging. And also our mental health and chronic pain issues post-lockdown as well. So physiotherapists, I think, are in a good position to actually hear that and to actually see that as well, that there are some mental health issues that we can actually deal with and pass on the relevant information to the authorities, or to refer on to the appropriate health professionals. So some of the things that we actually also saw was, we saw the Australian Physiotherapy Association really do a consumer campaign, trying to target some of these issues, such as, if you're working from home for extended periods, you may have shoulder pain, or if you're sitting for longer periods in quarantine, you might have stiff knees and a bit of pain. This is where physiotherapy can help. We also provided some lockdown information. So as soon as the government would release any lockdown information, we would actually provide it onto our Facebook pages and all our social media pages to get the message out as soon as possible. And then we had our coronavirus COVID-19 website that had links to all the organisations, PPE, all the lockdown information that anyone needed. And this could be state-based information. It could have been any business continuity, anything information about COVID-19, some of the member services and support, such as signs and things to wash your hands, to make sure that you get tested if you've got any type of COVID symptoms. And then also all the codes and regulations for the tele-rehabilitation or the tele-physiotherapy, to ensure all our members had the up-to-date information about privacy, about confidentiality, about the data storage and things like that's required when you're going into a telehealth or a digital age, and also some of the infection control issues as well. So you can see we had two waves. Hopefully we don't get the third. We did have some downturn in offerings or in service delivery. We did have to reduce some of our clinic hours, but it's rebounded back. We're seeing different things. We're seeing more overuse type injuries, and probably more from adolescents as well as the older community, as they start to recondition post-COVID. So I'll leave it there and ask for the next panelist.
All right, thank you very much, Mr. Scott Willis.
Thank you.
Next up, we have a presentation from Mr. Kajuto Handa.
こんにちは。日本理学療師協会会長の半田でございます。こういう日本国内でもですね、いろんな学術集会等々でコロナの影響で対面でということはなかなか難しい状況であります。そういう中でインドネシアのこういうのにお呼びいただきましてありがとうございます。今日は日本におけるコロナの影響等々について少しお話ししろということでございましたので、そういうお話をさせていただきたいというふうに思います。昨年の1月に日本では COVID-19 の拡大ということが出てまいりました。そして昨年の3月4月ぐらいに第1波が起こってきたわけです。まず最初に日本理学療師協会が対応必要だったのは、13万人弱の理学療法士の方々が感染予防に対しての知識がそれほど豊かでなかったということについてですね、そこの補正をどうするか、これ急遽ですね、動画を作ったりして会員たちに周知をするようにいたしました。そういうこともあってですね、臨床現場における混乱というのは割と急速に収束できたのかな、そのように思っているとともにですね、理学療法士教育にあって感染予防等々についてちょっとやっぱり今後拡充する必要があると、そのように理解をしているところであります。 それと本会にとってですね、今後さらに必要なことは何かっていうのは、学生教育の問題であります。ほとんどの病院が第三者の院内立ち入りを禁止しておりますので、学生も臨床実習に行けない状況が今でも続いております。要するに教育の最後である臨床教育、これが不十分な状態で国家試験を受けて通っていく、そのようなことになっております。この問題についてはですね、ただコロナが収束したからその問題がなくなった、そういう問題ではないだろう。今回としてはこの問題について引き続き数年間フォローする必要があるというふうに思っているところであります。それとこのコロナが COVID-19 が拡大していく中で、本会が日本の国内でどういう役割の変化が生じたかについて少しお話をさせていただきます。日本ではですね、いくつかの病院でクラスターが発生いたしました。その中で日本国内で深刻だったのは看護師さんたちが感染していくという問題でした。病棟の看護師さんが集団で感染して自宅待機等々が起こると、病棟の勤務が組めない、夜勤が組めないという問題が発生してきました。私たちは理学療法士として看護師さんと共にですね、夜勤を一緒にやりましょう。そしてなんとかこのクラスターを乗り切りたい。医療が崩壊すれば困るのは患者さんたち、地域住民の人たちです。その崩壊を防ぐためには、我々が看護師さんと共に病棟勤務に入る、そのようなことを実施しているところであります。もう一つはですね、ワクチン接種の話もありました。これについて非常にデリケートな問題ですので、今後どうなるのか分かりませんけども、ワクチン接種、医師と看護師だけでやってもとてもじゃないけど間に合わないということで、いろんな職種の可能性について話をいただきました。そうしたいろんな職種の中でですね、筋肉について一番詳しいのは理学療法士であろう。三角筋に注射をするということを前提になりますと、三角筋という名前聞いただけですぐ分かるのは理学療法士だろう。そういう意味から研修を受けた理学療法士がワクチン接種するのどうだろうというような提案もありました。非常にナーバスな問題で今日本政府でさまざまな検討をしております。私はこの問題についてはですね、若干やっぱちょっと心配をしております。万が一何かトラブルがあった時の責任問題ということについてですね、やはり考慮する必要もあるのかなというふうに思っているところであります。それともう一つはですね、コロナがいずれ収束した後に理学療法士の役割、あるいは組織、日本理学療法士協会の組織として今後どういう役割になっていくのか、そのことをしっかりとですね、論議して、この COVID-19 をどう有効に生かすのかということについてですね、慎重に、そして積極的に日本理学療法士協会としては今後対応していきたいというふうに思っているところであります。以上で日本における COVID-19 における対策等々について説明をさせていただきました。いずれ COVID-19 が収束したときにはまた皆さん方と集まってですね、いろんなことができればというふうに思いますし、2023年には日本で国際学会をやりますので、ぜひインドネシアの方々も日本においでいただければというふうに思っております。本日はどうもありがとうございました。
Thank you very much, Mr. Kazuto Handa from Japan. I would like to welcome our first presenter, Ms. Sin Yili from Singapore.
Hi, good evening, everyone. I hope everyone can hear me. Thank you for having me during your conference, and I hope we will learn from one another during this session. Okay, so basically today I'm going to share a little bit about the Singapore Physiotherapy Association and our profession's role during the COVID-19 pandemic, which we are still going through right now. So just a little bit about ourselves. Okay, so our vision is to be united as one voice and advocate for high standards of physiotherapy in Singapore. And these are our three mission statements, looking at three main pillars of our work, which is about our business, which is encouraging high standards of physiotherapy practice, education and research, how to create an environment where we can continue to promote safe, effective and proven clinical standards in practice, and through supporting and uniting physiotherapists in Singapore and beyond. And it is important that during this COVID period, which will continue on for a period of time, that we continue to promote these three pillars and stay true to our three mission statements. And henceforth, I will share a little bit about what the profession has been through, and I guess what Singapore has been through during this period of time. Just a little bit of background. In Singapore, we can find physiotherapy services in various sectors. We have our primary care sector, which includes our private sector colleagues. We have physiotherapists in hospitals. We have physiotherapists working in intermediate and long-term care sectors, which includes our nursing homes. We have what we call our day rehabilitation centers as well, which are our center-based and residential-based services. We also have physiotherapists working in home-based services, where we go to our patients' homes to provide these therapy. And so what really happened in the timeline that happened last year was that on 30th January last year, we had our first correspondence with the Ministry of Health, Chief Allied Health Officer's Office on the concerns of the profession with regards to the COVID-19 situation. And that was then after our liaison with the Ministry of Health that we had the first Ministry of Health circular that went out to all allied health professions, associations and societies. Okay, and prior to this, actually the Ministry of Health did not have any circulars coming to the associations. So it was really important that we had that first correspondence with them then in January. Right, and it was also in 15 and 16 February that we started to engage our private physiotherapy sector a little bit more as well, and that was when we published our first advisory. And that was because through our engagements with the ministry, we realized that our colleagues in the private sector have kind of forgotten from a lot of the information, and we realized that they were not receiving a lot of critical information that was needed to keep their patients safe and to keep them safe in their practice. And that's why we published our first advisory on 16th February. Singapore went into our circuit breaker on 7th April to 4th May. Okay, and subsequently we launched our first telehealth guidelines 11th April as well, with the help of our fellow allied health associations, and we have also put in some of the resources from our fellow colleagues as well in the other physical therapy associations, right? And during this period of time, as I will describe subsequently, it was extremely difficult because there was a suspension of physiotherapy services in the community sector and private sector. And that was when we published and advocated for our patients in the Straits Times newspaper, okay, and that was written from the association to actually advocate for the need for rehabilitation to happen despite the difficult times. As you would see from this was a particular article that came out last year about the importance of maintaining essential rehabilitation services across the care continuum. Then during circuit breaker, all group and community-based rehabilitation were suspended, and this included our day rehab centers and senior activity centers. And rehabilitation can only continue via telehealth. And there was certain restrictions put forth, okay, that home rehab were only could only be provided to patients with significant disability and limited caregiver support. At this time, because the COVID situation was at its peak, we had physiotherapists, actually large proportion of them moving from outpatients into inpatient support services. At the same time, we had to segregate the physiotherapists that covering different settings. There was no cross coverage of services, and some of our physiotherapists were also actually put into the front line, where they were actually helping in the screening centers as absorbers as well. So some of us actually took up different roles during that period of time. Okay, and this was our paper that we published. It was kind of a response to the ministry. It was published in newspapers as part of our advocacy work. And since the start, we have been closely communicating with the Ministry of Health, and we were the conduit of support for our profession, particularly for the private physiotherapy sector, which we put them together in a WhatsApp group to make sure that we could understand any of their challenges, and if they have any questions, they can have easy accessible to us through WhatsApp, and then from there we will actually communicate to the ministry for any particular questions they have. At the same time, we also collaborated with the ministry to ensure that there was sufficient PPE and resources for our colleagues in the sector. Okay, this was our advisory for the private physiotherapy sector in our telehealth guidelines, and we had volunteers that came forth to actually help us with the telehealth guidelines as well. And it was only in 29 April that they recategorized outpatient non-public health institute allied health services as essential services. Again, that was then when we started to be able to resume some of our services in the outpatient setting. And one of the greatest lessons we learned is that rehab is certainly a priority for many of our patients, and we have to find some way to make sure that physiotherapy remains accessible to them despite the difficult pandemic times. And we had a group of our volunteers that also provided tele-rehab or tele-consult to some of our frontliners during the period of time. And we had our local papers that were published on COVID-19. At the same time, we appreciate the World Physiotherapy for some of the guidelines that was put forth as well, which we also put on our social media platforms and our website. Again, we also have our cardiorespiratory exercise and special interest group also put together a group of physiotherapists from different parts of Singapore who were actually taking care of COVID patients that were suffering from COVID, and they shared their experiences through a webinar session. And indeed, the situation has forced us to move out of our comfort zone, and all of our educational sessions have moved online since then. And we're also happy that we also collaborated with our Japanese colleagues on our webinars, which then this was our first joint webinar then, and we had a subsequent webinar as well on robotics after that. That was the previous one that I shared, and I guess part of it was about how we could turn crisis to opportunities, like many of our other colleagues have highlighted some of the opportunities that came with this pandemic. And with that, I would actually sum up my sharing about the Singapore Physiotherapy Association and some of the challenges that our profession has faced. And I guess moving forward is really how we can actually practice and I guess work and live in an era that is going to be really different from how it was pre-COVID. And I guess this impacts on us in terms of our role as physiotherapists as well. And I'm looking into with Singapore having, I guess, a bit of what we call our second wave, and we're having an increase in community cases recently. It tells us and warns us that we are not to let our guards down, and that we need to be prepared for this crisis to happen in the long haul, and we are going to be better prepared so that we can actually continue to provide our services to the patients that need us, whether or not they are suffering from COVID or they are suffering from other conditions. So we also just like to share that we're having our Singapore International Physiotherapy Conference come July, and we'd like to extend our invitation to all of you. And if you have any further questions, yeah, we can address them later. Thank you very, very much for your time.
Thank you very much, Ms. Xin Li. Next, let's hear a presentation from our last panelist on this session, Ms. Kidman Au.
Good afternoon, everyone. It is an honor to be here today representing Macau Physical Therapists Association to share about how this COVID-19 pandemic affects PT service in Macau and what we are looking forward to as a medical profession. Let me share my screen now. So before we talk about the challenges that we have faced, I would like to give you some epidemic information about the COVID in Macau. So we had our first case confirmed at the beginning of 2020. So far, we have 50 cases only in Macau, and 49 of them are already cured. And the latest case is confirmed last week, and this case is now under isolation treatment in the government hospital. We start our COVID-19 vaccination on February this year. And we have more than 87,000 people being vaccinated so far. And the Macau government has put a lot of effort to stop the pandemic, to control the pandemic, and that includes Macau Health Code. And we start our guarantee mask supplies for Macau residents very early in the pandemic. And also the quarantine policy started quite early at the pandemic too, at the beginning of the pandemic too. That really helped to control the virus spreading. So this chart is to show you the physios who work in Macau, where they work. So the orange part refers to those who work in both private and public hospitals. And for those who work in the community, you can see the gray one refers to those who work in the private practice, and the blue one who works in the NGO. After I have interviewed with a few physio working in the NGO, they share some challenges that they have faced during the pandemic. For those who work in the home care service center, they report that the workload have been increased since 2020. I think it is because the patients would rather be discharged from the hospital if the situation allows than stay in the hospital just to minimize the risk of infection. And for those PT that they report also that the psychological stress have increased because of the unknown risk of infection, and also working in an unsterilized environment, that they would afraid to be infected and then it spread to their family. So that give them some burden on their psychological level. For those who work in the nursing home center, because of the policy of social distancing, and so that some of the treatment area was repurposed in order to meet the criteria for visitors to visit the users in the nursing home. So the decreased treatment time and spaces make the PT who works there find that it is very difficult to give good quality service. And but at the same time, they were asked to maintain the users' health and function. So this is the challenges that they have faced during the pandemic. For those who work in the hospital, they also reported increased psychological stress at the initial stage of the pandemic because of lack of supplies of those PPE, and also they worry about the risk of infection in the hospital. And because at the beginning that the visitors are not allowed to go to the hospital to visit their relative or friends, the patients, so that the patients have to stay in the ward alone with this uncertainties of this virus at the beginning. And it gives the patients will also stress out. And so that the communications or the relationship between physiotherapists and patients are very tense at that moment because of this psychological stress. And for hospital, they maintain the inpatient service, like for those who are living in the hospital, and then they limited the outpatient service just to minimize the risk of infections or the spreading of the virus. So for those who work in a private practice, the clinic were asked to provide essential service only and consider to close their doors for 2 to 3 weeks at the beginning of the COVID pandemic. And after that, many of the clinics has followed the guidelines, the advice from the government, and after that we opened on the March of 2020, and then we separate the bookings quite apart to just to minimize unnecessary contact, and also, the price hike of PPE and sensitization products, and of course, the loss of from stop doing business gives the financial burden to those clinics or to those who work in the private sector. So as association, we also face some challenges. The first one is we have lesser chance to do public promotion for physical therapy, and we need to find a new way for CPT training. We used to invite lecturers, speakers to Macau to give us lectures, and now we use more the online system, the online platform, such as like webinars or pedros and online conference to keep our knowledge update. So what we have done during the pandemic, we were interviewed by different media to share the knowledge of home exercise, that including on TV or on the magazine. And we also record a video for PT Day 2020. And this video is based on the recommendations you can see here. Let me see. Yeah. So you can see here that we have posted this video on our Facebook. That
Agriculture was born of environmental and European traditions. The 8th of September marks the annual World Physiotherapy Day. To celebrate this special occasion, let's join physiotherapy.
This video is shot at different heritage sites of Macau, and the exercise that we practice in this video is according to the recommendation of rehabilitation for patients who recover from COVID-19. And you can find this on the World Physio website under our the PT Days resource. Okay, so let's get back to here. And of course, during the pandemic, we're so lucky to be able to host the Congress of ACPT 2020. And it is a hybrid event. And for those who live in Macau, of course, they can attend under certain criteria. And for those who are internationals, PT, that they join us online I remember it's like last October, right? Yeah. So, yeah, and the vision we have for the PT development in Macau is raise up the role of PT in wellness promotion. Many people know PTs as treatment professions and injury prevention professions, but I really like to encourage all PTs, including myself, to have a wider view of what we can do for the community. We PT as exercise experts, and we should use our expertise to encourage people to chase for the health, the community in the community, and also I would like to see the planning ahead of the telehealth service for pandemic situations or the natural disaster situations that we have suffered a few years ago. And this really help the community or the patients in the community to keep their health or their functions during these difficult times. And yeah, I think that's all we have to share. And yeah, I hope this presentation gives you some impression of how we Macau physical therapists were doing, and life in Macau is almost back to normal. Normal means like before pandemic. Of course, we still need to wear masks every day in public place, and the nuclear ACE test is required for traveling between Macau and China. And also quarantine is compulsory for residents who come back from other countries and cities. So on behalf of Macau Physical Therapists Association, I would like to send you best wishes. And I hope that this pandemic situation will be over soon so that we can meet each other in person in the future. So thank you for this opportunity. I hope this Congress will be also a great success. Thank you. So bye-bye.
Thank you very much, Ms. Kitman Au from Macau. And thank you for all panelists for the excellent presentation. Now we come to question and answer session. I would like to invite Mr. Scott Willis, Ms. Xin Yi Lee, and Mr. Tomonori Ito from the Japanese Physical Therapy Association to join the discussion. Unfortunately, Ms. Kitman Au are not able to join in this panel. Thus, we are going to discuss with the other panelists for the next 10 to 15 minutes. All right, I'm going to start off with the questions for all of our panelists. It is interesting that Mr. Kazuto Handa has mentioned that physiotherapy needs to increase knowledge about infection. And I'm going to start with Mr. Scott Willis. What do you think about it?
Yes, great question. Yeah, definitely. I think I always look at COVID-19 as an opportunity, and I think from a physiotherapy point of view, it really highlights that we need to really understand the infection, how the infection happens, what the pathophysiology is, but also then the prevention and treatment of it as well. I think we can value add to that as part of our role as a first contact practitioner. And I think we've got a rapport with our patients to actually educate them on these issues as well. So it's not just about our knowledge of it for ourselves, but also to embrace that and pass that on to the patients that we see as a daily thing. And that also includes vaccinations as well. I think we have the medical knowledge in the background that we can actually then pass on that to our patients as well about the vaccinations and the reasons why some of the contraindications or some of the barriers that might be available as well.
Great, thank you very much. And how about you, Ms. Sinyeli? You have something to add?
Yeah, I just thinking that we've moved from an era of infectious disease in the past and to treating individuals with chronic diseases, because that seems to be one of the main issues that we're dealing with. And I guess in the past year or so, we've been going back into the infectious disease of this era could be very different from how they were previously. So I think it is important for us to understand that, and more importantly also that this particular infectious disease, or maybe in the future other diseases, not sure, could actually have prolonged effects on a person's body and how it impacts on the person or the patient in the long run. I think physiotherapy will have a huge role to play, not just in terms of treatment, but I guess in terms of our research, and I guess subsequently is then educating more and more people to understand some of these conditions and its chronic effects. Yeah, thank you.
All right, thank you very much. And let's us hear from Mr. Tomonori Ito from the Japanese Physical Therapy Association. Any thoughts?
Well, thank you very much indeed. I'm not like the person who can present in the center of Katsupahanda, deputy president. However, in my understanding, it could be we have like pros and cons. Like if we have look at the like scope of practice with the COVID-19 new era, maybe like the physical therapists may have more responsibility. At the same time, risk can be with us. So we need to do very much carefully in terms of like professional practice. Thank you very much.
Thank you very much. All right, the second question is coming from the audience. She said that she really interested and agree about the promotion to the patients. How to improve the promotion of wellness to patients and public that physiotherapist community do in your country. Thank you very much for your sharing. We can start with Mr. Tomonori.
Well, maybe difficult question in my understanding. If you could add or start, Mr. Please.
Okay. And Miss Sin Yili, any thoughts?
Yeah, so I think the question was about how do you educate the public about the role of physiotherapy.
Exactly.
Yeah, and I guess the means or the methods that we have now are so much more than we used to have. I think last time we used to have, at least for our association, we used to have like face-to-face events, and those that usually need a lot of time to plan and things like that. But I guess nowadays we have really moved on to the internet, right? And then your social media platforms where we started to invest a bit more in terms of infographics. We've gone on to podcasts as well as YouTube channels, and I guess all these are more accessible to people, and now people if there's nothing to do at home, they can maybe just put on their earphones and they can listen to some information about how to take care of their shoulder, how to take care of their knees. So I think the information communication channels have changed quite broadly as well, and I guess it's also equipping some of our public with some of these resources. Okay, moving on online, some of them may have some challenges as well. So certain part of our population may need some help in terms of that. I guess that's something we also have to keep in mind, not to forget this population. I mean, in the midst of us going into all these new social media, there is a part of the population that may not have access. So we do need to think how best to reach out to them, whether is it through their caregivers or through other forms of outreach.
Thank you. And Mr. Scott Willis, any thoughts on this issue?
Yes, definitely. I think social media and digital mediums are the way to go at the moment, especially here in Australia. And it's very interesting. Our older population is one of the highest growing social media outlets in Australia. So we're really targeting that cohort in our advertising to the consumer from the Physiotherapy Association here in Australia. I think also we underestimate our influence on the consumer to actually go and influence other consumers as well. So I think we're educating a lot in Australia, our physios, to actually educate the consumer that's in front of them to actually go and do our consumer knowledge and consumer awareness out into their community as well, because I think they actually boast and get the confidence if it comes from them compared to if it comes from us.
All right, thank you very much. And I'm going to open a question from audience at this point, but before that, we already have another questions coming from the audience on the chat box. And the question is, the problem that has arisen at present is the rehabilitation of long COVID. Does the panelists have a project in the future of cooperation between countries to make a guideline, research study, or campaign related to this matter? And maybe you can give suggestion of how the role of physiotherapy and how to deliver appropriate communication about long COVID rehab, so it can reach all levels of society and regions. Because Indonesia here has a fairly large area, how to effectively do that, maybe you can share the opinion. We can start with Mr. Scott Willis first.
Yes, thank you. Another great question. And this is a personal one for me because I still suffer from some long COVID symptoms. So I think, you know, if you tuned into the World Physio Congress last month, I think it was, there were some significant presentations from some cardiothoracic physiotherapists from the Canadians, the UK, as well as the United States, that have done significant research into this area, and they're starting to produce some of the research findings on social media, so Twitter. So if you look at Twitter under long COVID, you will find that there are some significant resources available already on some of the rehabilitation, how to take it to some thresholds using oxygen saturations, using heart rates, and also rates of perceived exertion. So they'll give you some parameters of how to actually rehabilitate your patients with long COVID. It's all about pacing. It's all about staying within the cardiac parameters of heart rates and rates of perceived exertion, as well as the oxygen saturation, because what we're finding is that sometimes it desaturates, but also if you take their heart rate above a certain amount, then it can actually add to their malaise and feeling of fatigue. So I think from that, I think you can actually then start to get some really good protocols together from the research starting to happen now.
Great, thank you very much. Ms. Sinili, you may add something.
Maybe I'll address the second part. I guess the second part is about how we can deliver appropriate communication in Indonesia. I do not know what are the pillars that you have in Indonesia, but I guess the first thing is to identify who are the key people, whether it's the organizations or champions that will be able to spread some of these information. I guess in Singapore, definitely we are smaller in that sense. We do have various sectors being taken care by various ministries. So, for example, the Ministry of Health will take care more of the, for example, the overarching the hospitals primarily. Okay, they'll send information down to the public hospitals. We have another agency that takes care of our intermediate and long-term care sector, and they will take care of the nursing homes, the day rehab centers, and the senior activity centers, for example. And then the association comes in to then support the private sector, for instance. So I guess in a way, we work together to help to make sure that information goes to the physiotherapists in the different sectors as much as possible. Yeah, so I guess we can go back to the social media platform as well as one of these means. Yeah, so I guess in Indonesia that will require some exploration in terms of what is where's that satellite that you can send out information from. Yeah.
All right, thank you very much. And now we have Mr. Rijal, who would like to speak to the panelists.
Okay, thank you for your chance to. This is actually another interesting topic that we have to face when we apply physical therapy services in our back home, especially in Indonesia. And I really interested with the one of slide presented by physical therapy from Macau, that physical therapy also face the psychological issue when the physical therapy apply physical therapy services to the patient. So based on your experience, for all of your speakers, how do you minimize for the psychological issues for physical therapy in conducting physical treatment in hospital or clinic? Thank you. Hello.
Yes. All right. Maybe we can start with Ms. Yili.
Sorry, could I just clarify, are you referring to psychological concerns of the therapists themselves or the patients? Sorry, I'm just...
For physical therapies, because for physical therapy, because when we try to apply like physical therapy treatment in hospital, we also actually found something like psychological fear when we try to treat the patient.
I see. Okay. So I guess part of it, part of this whole COVID journey, at least within the hospital that I work, and I guess also the environment around, is really taking care of our mental health, if that's really part of it. And I guess in where I work, we have a group of us that particularly look at this. So within different departments in the hospital, we started to have our welfare officers, and within the hospital, we also have this larger group of us who then looked at certain mental health activities. For example, we now have every Monday, Wednesday, and Friday, we have a 15 minutes mindfulness sessions for anyone who can log in, and so the physio, if you feel stressed, you can also log in, and then it's also pre-recorded. It can be found on our hospital's Facebook. So anytime you feel like doing it in the evening, you can go online as well. And I guess so, and then there's also a lot of public that comes in to support us through our letters and gifts and all these are all publicized on the hospital domains. And I think this also helped encourage staff that the work that they do is meaningful. So just some examples. Mental health is definitely important during this phase. So maybe pass to the other panelists.
Thank you. And Mr. Scott Willis?
Yes, we saw this in Australia when we actually came back to work from a significant downturn or a significant lockdown, and our staff started to come back to work. Some of them really struggled returning to work because of the fear and the lack of confidence. Because I think early on, not so much now, but early on, we didn't really know a lot about the pathophysiology. We didn't really know about the transmission. We didn't really know how aggressive this was. So I think it's like anything, giving what you have in terms of information about the disease process or the transmission, making sure that the PPE is significantly probably higher than what's required to actually get them the confidence. And the third thing, I think, like what we did was actually offer the employee assistance program. So any type of psychological or counselling service before they came back and during their return to work as well, just to check in and offer them someone a little bit different or an independent person to their workplace to actually they could talk to and hopefully allay some of those fears when they return to work as well.
All right, thank you very much. And I think that's the last question from the audience because we're running out of time. My final question to all of our panelists, it will be, what's the final piece of advice you'd like to give to the audience? Maybe we can start with Mr. Scott Willis.
I think my final piece of advice is, as a community, as a physiotherapy community, we all stick together. I think we gave each other a lot of support during the pandemic and ongoing now. And I know that a lot of businesses here in Australia struggled, but we are seeing a lot of recovery now and rebounding back to a bigger and better service delivery than what we did now. We're also seeing some different things that are starting to come out of COVID-19 as well. So some different treatment modalities, but also some different things that we're actually treating and seeing within the clinic as well.
Great, thank you very much. And from Ms. Yili, any thoughts?
Yeah, so I mean, I echo the fact that I think we need to be together in this, and I think during these periods, times are difficult. Take care of ourselves, take care of each other, and I think we have always each other for help now that we can reach each other easily through different platforms. Yeah.
Great, thank you very much. And from Mr. Tomonori Ito, you would like to add something?
Yeah, well, yes, because in this era, we have a lot of technology online. So we can do something like, like webinar or like this kind of congress in this timing. So I think this is the timing to get together more to sharing the knowledge and also experience to contribute for the patient or the people who have suffered from the COVID-19, and we can bond and tie together and cooperate together for people who need the physiotherapy. Thank you.
Thank you very much. Ladies and gentlemen, finally we come to the end of the first panel session. Before we end this session, let's take a picture first. So please open the camera. Put the best smile on. And the committee will give the comment. First slide.
Are you ready? 1, 2, 3. Okay.
Okay.
All right, thank you very much.
Finished.
All right, thank you very much. And thank you for all panelists for joining us. We really do appreciate your perspective on this very important issue. And we will have a brief break, and after that, we will continue for the second panel discussion.
Each tube of Voltaren Emul gel contains 0.2 grams diclofenac diethylammonium, calculated as diclofenac sodium, for the relief of mild to moderate pain in muscles, soft tissues and joints, and for symptomatic treatment of osteoarthritis. Voltaren Emul gel is a combination of gel and cream for topical application, which enables penetration into the aqueous and lipophilic environment of the skin for relieving pain, reducing inflammation and swelling, and improving mobility. First, one must identify the specific pain point by assessing the affected area, such as muscles, soft tissues, or joints. Then one should apply Voltaren Emul gel by squeezing 3 to 5 centimeters of Emul gel to the affected area. Rub the product using a circular pattern. In vitro studies have proven that rubbing Voltaren Emul gel for 45 seconds can increase diclofenac flux through the skin up to 5-fold at 8 hours. It allows Voltaren Emul gel containing active ingredient diclofenac to penetrate deep into the skin to a depth of up to 1 centimeter. The first analgesic effect may occur 1 hour after application, as shown in a study for neck pain. Use Voltaren Emul gel non-greasy formula 3 to 4 times a day. Voltaren Emul gel is composed of a non-greasy formulation that combines gel and cream for topical application that enables penetration into the aqueous and lipophilic environment of the skin. The hydrogels within the gel base form a semi-permeable barrier that allows water evaporation, thus cooling and soothing and allowing penetration into the skin. When applied to the skin, diclofenac accumulates within the lipid component of the emulsion. The lipids then come into contact with the skin surface, where the active ingredient is released and enables penetration into the aqueous and lipophilic environment of the skin. Diclofenac accumulates in the skin, which acts as a reservoir from where there is a sustained release of drug into underlying tissues. Pain, such as that in muscles, soft tissues or joints, is caused by tissue damage, which induces the release of membrane phospholipids to activate the arachidonic cascade. Phospholipase A2 catalyzes the first step of the cascade, converting phospholipids into arachidonic acid, which can subsequently be oxidized by lipoxygenase to produce inflammatory leukotrienes. Additionally, COX-2 converts arachidonic acid into prostaglandins, which activate nociceptors and induces the feeling of pain. Diclofenac's main mode of action is reversible inhibition of the COX enzymes, with a selectivity for COX-2 over COX-1, which reduces prostaglandin synthesis and accounts for diclofenac's anti-inflammatory, antipyretic, and analgesic effects. Inhibition of the COX-2 protein decreases the production of prostaglandin. The first analgesic effect occurs approximately 1 hour after application, as shown in a study for neck pain. Diclofenac is also a potent inhibitor of phospholipase A2 activity. Evidence indicates that diclofenac also decreases the production of inflammatory leukotrienes. These additional processes may explain the high potency of diclofenac. Topical administration of Voltaren Emul gel results in low systemic exposure to its active ingredient, diclofenac diethylammonium, that is equivalent to 3 to 7% of the applied dose. Plasma levels are well below the range at which systemic adverse events usually occur. Voltaren Emul gel is specially formulated to deliver topical diclofenac diethylammonium to relieve soft tissue pain and reduce inflammation and swelling in painful conditions such as osteoarthritis.
Ladies and gentlemen, as we previously discussed on the first panel, the COVID-19 pandemic has brought challenges to the physiotherapy profession. There are many issues to be addressed in this emergency. It is therefore important to highlight the role of organization to support physiotherapists during the COVID-19 pandemic. In this session, we have the President of Philippine Physical Therapy Association, Mr. Michael Gabilo. Good afternoon.
Good afternoon.
How are you?
I'm good. I'm good.
All right. And then the President of Afghan Association for Physical Therapy, Mr. Muhammad Shakir Ahmadi. Good afternoon. And the President of Malaysian Physiotherapy Association, Mr. Haidir Manaf. Good afternoon.
Ya, good afternoon. Salam sejahtera. Selamat petang,
Salam.
selamat siang.
Terima kasih.
Yeah.
All right, before we get started, I would like to go over a few housekeeping items. The session will last for 1 hour with a 10 to 15 minutes lecture from each speaker, followed by the Q&A session. The participant will have the opportunity to submit questions into the chat box. If you would like a specific panelist to answer the questions, please mention the panelist name first, then the questions, then the context. And during the session, keep your microphone on mute mode, and if possible, turn on the camera. Without further ado, I would like to welcome our first presenter to the second panel, Mr. Michael Gabilo.
Thank you. Is my audio working good?
It's very clear.
Yeah. Okay, thank you very much. If I may share my slide first.
Sure.
Is my first slide visible now?
Yes.
Okay, thank you. Thank you very much. A pleasant day to all. The COVID-19 is undeniably a defining global health crisis in the history of the human race. New challenges surface in various sectors of the society. Different agencies, both locally and internationally, are racing to slow the spread of the etiologic agent to somehow lessen the impact of COVID-19 by imposing policies and guidelines. I would like to thank the organizers of the Indonesian Physiotherapy Association International Conference and the Executive Board of IPA for inviting me over and share to you, to share to our Indonesian PT colleagues, how did we continue to deliver physical therapy services, adapt to the changes, and respond to the needs of the society amidst this global health crisis, the COVID-19 pandemic. As we continue to respond to the demands of the pandemic, it generates a lot of uncertainties, questions, dilemmas, fears, and not to forget opportunities. Opportunities to identify gaps in the physical therapy practice and eventually come up with recommendations and solutions that are all supported with valid and reliable evidence to address these pressing concerns. In effect, this will better improve the delivery of physical therapy services. This slide shows the current situation of COVID-19 in the Philippines as far as, number one, the number of cases, the number of active cases in the country right now, the reproduction rate or reproduction number, and the bed utilization ratio or rate. This is not an impressive data though, but compared to last year's data around August of 2020 and this March 2021, I could say that the number of cases, the number of active cases are starting to decline because of the imposed policies and guidelines by the government, such as physical distancing, the different quarantine classifications of the different areas of the country, and the minimum health protocols. As part of the healthcare sector, the PT clinicians and practitioners and healthcare providers should provide interventions with prudence, that is, implementing more stringent infection prevention and control. We in the Philippine Physical Therapy Association and its members, we constantly remind our practitioners and colleagues to be more conscious in the available alternative strategies such as teletherapy or telerehabilitation for us to continue the delivery of physical therapy services without compromising the health and safety of our clients and the practitioners, considering the nature of our physical therapy practice entails physical contact with our clients or patients. The Philippine Physical Therapy Association recognized the seriousness of this threat to the public health and its impact on the practice of the profession in the country. March 11, 2020, when the World Health Organization declared COVID-19 as a pandemic, wherein there are about 100,000 cases and 4,000 deaths in 114 countries at the time. In the Philippines, the president declared the entire Luzon to be in the enhanced community quarantine classification. A state of calamity was also declared. Other parts of the country, provinces and cities outside Luzon, later imposed their own quarantine measures. On March 18, 2020, the association issued its first official statement in connection with the COVID-19 crisis. The aforesaid document contains frequently asked questions and we provided links to relevant reading materials that essentially aims to facilitate in clarifying pressing issues and concerns related to the practice of the profession and matters related to their patients. Cognizant of our mission to be at the forefront in improving the delivery of physical therapy services in the country, we opted to get the pulse of the PT professionals and PT students through a short survey that will somehow assess the impact of COVID-19 outbreak and the effect of actions of the government, like the declaration of the quarantine classification. This survey will also help the association in determining the upcoming projects of the association. The survey was divided into 4 sections: the profile of the respondent, the level of awareness of the respondent about the COVID-19, the sources of information on COVID-19, where do they get their information, and lastly, the impact of COVID-19 on the practice. A bigger chunk of our respondents were clinicians working in hospitals, both in private and government hospitals, privately owned or free PT standing PT clinics, home health care practice, and also in community-based rehabilitation facilities. As to the question, what level of impact do you expect this pandemic on your practice? 82% answered high, 17.2% reacted medium, and the remainder answered low. We have also asked our colleagues to give a rationale on why they answered that way. For those who answered high impact, the economics was the prevailing justification and expressed by mostly of the PT practitioners, particularly those in the home health care settings, owners of freestanding PT clinics, clinical consultants, part-time faculty members working in higher educational institutions. This has been an action point of the association and prompted the association to air the matter and sought some form of assistance from the government. It was raised and discussed with the Department of Labor and Employment in the country. We would also like to ensure that our clients, along with the well population, continue to make progress toward their goals and recovery, and as our commitment, to promote wellness of the general public during this uncertain period, the association launched a nationwide online aerobic session with physical therapists. Thus, we have this campaign called #Induct. Induct is a Filipino term. When translated to English, it means to dance. We have also encouraged our colleagues to create infographics and infomercial, whether it is an individual or an institutional effort. These are some of the examples made by our colleagues from the University of the Philippines College of Allied Medical Professionals, showcasing exercise guidelines for people with disabilities that will keep them healthy while in home quarantine. As our way of expressing solidarity with the frontline workers, PPTA partnered with private individuals and companies in providing protective personal equipment and other goods in some of the government hospitals. We prioritize the COVID referral facilities so that we can provide support to these facilities, which are at the time and even up to now very toxic in addressing the needs of the patients coming in their hospitals. And we also received reports that some of our PTs are not being provided with PPE. So this is our way of showing the hospital administrators that PTs are also healthcare frontliners, thus should also be prioritized. PPTA being a relevant driving force in advancing the standards of physical therapy practice and education in the country, a set of interim recommendations was issued to practically guide and assist the physical therapists practicing in the country in making guided decisions as to infection control in their respective settings and facilitate their delivery of health and physical therapy services across various settings, such as in the hospitals, freestanding PT clinics, community-based rehabilitation facilities, and home health care practice during the community quarantine classification. In this, and of course, not to mention the people, the practitioners in the academia. In this particular document, we presented the 3C framework. What is this 3C framework? Stands for care, communicate, and cooperate. This document was published in the COVID-19 Information Hub of the World Physiotherapy. We again thank the World Physiotherapy for coming up with that kind of initiative of collating all documents coming from various parts of the world so that we can have an easier collection and glimpse of all these references. This framework reasserts the continuity of physical therapy services as part of the essential health services during the COVID-19 pandemic. This document also underscores that all stakeholders must be guaranteed of their individual rights to health and safety, or what we call the end-to-end co-responsibility. As part of our celebration of the World Physical Therapy Day last year, 2020, we made some translations of the existing materials of the World Physiotherapy. We translated it to our official language. But like Indonesia, we are both separated by bodies of water and mountains. So we have regional dialects as well. So for us to really show and express the importance of physical therapy in the rehabilitation, in the management of COVID-19, we also activated our chapters, different chapters in the country, and our publicity committee to further translate this material to regional dialects. So these are some of the examples of the publicity materials converted or translated to regional dialects. We are all familiar with this slide. Physical therapy has 4 spheres, and we should not be limited to rehabilitation. Physical therapy should be integrated across all levels of healthcare. Physical therapy should not stop during the pandemic. Because again, we are not just only confined with the rehabilitation of post-COVID patients, but rather we have also an important role in preventing the deleterious or serious effects of COVID-19. A lack of physical therapy access can actually lead to compromised health and social, it can compromise health and social outcomes and extend inpatient stays. In a survey conducted by the World Health Organization, rehabilitation was the second most frequently reported service disruption or field or health service that was disrupted during the pandemic. The physical therapy in the COVID is required for the continuation of physical therapy services for people with essential needs. And many literatures have already cited the importance of physical therapy and that can optimize the outcomes of patients severely affected by COVID-19. Clinically, PT plays an important role in managing and addressing concerns of COVID-19 from acute to subacute up to the last phases of COVID-19. Because of the certain constraints like physical distancing, limited human resources, and the risk of infection, the word telerehabilitation or teletherapy has been highlighted. In our March 18 issue, we defined teletherapy or telerehabilitation as a form of physical therapy delivery service via information communication technologies and other devices. Recently, we made physical therapists, by the way, are considered to be netizens. And as netizens, we should be very conscious in maximizing the use of web, the use of internet, and other ICT gadgets. So we opted to have this webinar for physical therapists, wherein we discuss different online content, the possible online content. We even mentioned different available platforms that can be maximized, and at the same time, the ethical responsibilities of physical therapists in online practice. And this pandemic, like what I mentioned a while ago, this really highlights opportunities to highlight our roles, not just only clinicians. In this pandemic, we have to really stand up. We have to really make our efforts to advocate and reinforce our profession. In our country, we really activate the physical therapy practice through our chapters and special interest groups. In the academe, we are able to come up with this guidebook of best practices and recommendations in physical therapy education, basically by looking at different teaching learning strategies in a flexible learning mode. And since the cases are starting to gradually decline in the country, we are already preparing our higher educational institutions to start preparing for a gradual resumption of face-to-face classes and internship. We should also be, aside from advocating our profession, we should also be advocating for physical activity. We have to promote health and wellness to our to the general public by providing health education, telling what's the nature of COVID-19, our responsibilities to our patients, to clients and caregivers, provide stringent infection prevention and control, improve one's immune system, and how to improve one's immune system, and promote home exercises programs. In the country, the role of being a health safety officer was also highlighted. So some of our colleagues are positioned in different in the different facilities as health and safety officer, ensuring the proper personal protective equipment are the techniques are properly instructed to the staff, to the office, to the different officials of or personnel of the hospitals. So they acted as health and safety, ensuring that all protocols are properly implemented and followed by the employees or the employees or the staff. This pandemic should also highlight the use of evidence-based practices. We should be consumers, if not producers. But of course, it would be nice if we are producers of research. But more importantly, as practitioners, we have to be very conscious of the different interventions and techniques that we are providing to our patients. Through this evidence-based development efforts, we are able to make critical examination of demonstrated intervention effects. And as such, we are able to process these findings, because these findings, the result, the outputs of the research can definitely be definitely incorporated into policy and practice decision. As collaborators, we should be working together. We should be open-minded in linking and networking with local and international professional societies, government agencies, researchers, and health and educational institutions. We in the Philippine Physical Therapy will be there to collaborate with local and international bodies in fighting against this COVID-19 and ensuring the delivery of physical therapy practice will still be continued despite of whatever future disturbances that might happen in the world. As a takeaway message, I'd like to say that we are positioned we are best positioned in the healthcare system because we can produce the risk factors and prevent and manage complications of COVID-19 by providing patient and client education, prescribing physical activity and exercises, and perform non-invasive hands-on interventions consistent with a biopsychosocial paradigm. And aside from clinical roles, we are also expected to perform non-clinical duties in addressing health and wellness concerns brought about by the COVID-19. These are the references. This was the picture taken 2018 when I visited Bali, Indonesia, as part of your conference. And I would really like to visit your country again in the future. And let's be united in advancing our profession forward. Thank you for the opportunity.
Thank you, Pat. Thank you very much, Mr. Michael Gabilo. Before we continue our panel, let we all hear a message from the Indonesian Minister of Health, Mr. Budi Gunadi Sadikin.
Assalamualaikum warahmatullahi wabarakatuh. Salam bahagia, salam sejahtera bagi kita semua. Om Swastiastu, Namo Buddhaya, salam kebajikan. Pada kesempatan yang berbahagia ini, saya ingin menyampaikan ucapan selamat kepada Ikatan Fisioterapi Indonesia atas penyelenggaraan kegiatan temu ilmiah tahunan fisioterapi ke-34, International Conference 2021, dan Kongres Nasional ke-13 sebagai upaya untuk meningkatkan kompetensi fisioterapis di Indonesia agar dapat berkontribusi optimal dalam meningkatkan derajat kesehatan masyarakat. Ucapan selamat juga saya sampaikan kepada Ikatan Fisioterapi Indonesia. Tepat pada tanggal 10 Juni 2021 akan memperingati hari jadinya yang ke-53. Wassalamualaikum warahmatullahi wabarakatuh. Om Santi 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 Om.
Now let's welcome our second speaker presenter, Mr. Haidir Manaf from Malaysia. All right, time is yours.
Okay. Once again, I'm so sorry. Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. Thanks for the opportunity to share about the, what you call it, post-COVID management or the adaptation after the COVID-19, especially in Malaysia. So based on the COVID-19 pandemic that been caused by the infections with the virus known as the SARS-CoV-2 has created a complex scenario for global health with various type of complications and levels of function impairments in millions of individuals recovering from the disease. So as the Malaysian Physiotherapy Associations, with the help by the Physiotherapy Profession Technical Committee, Ministry of Health, are aware the concerns regarding the COVID-19. We are committed by supporting the physiotherapists, also the patients, and also the public health efforts, as well as providing the reliable informations to support sound decision making. We always continue to monitor the situations and provide our members with relevant up-to-date information as become available. So I will share the slides, or been conducted by the organizer?
You can share by yourself, or we can also help you if you want.
Okay. Okay, now you can see my slide, right? All right. So as for today, the numbers of new cases are getting increasing in Malaysia. So by today, that we're waiting for our government to declare for the total lockdown again, for the second time for the total lockdown, because the number is still increasing. Previously, the number is only about less than 1,000, but since after December 2020, the number keep increasing from 3 digits until now becomes about 6,000 new cases per day. And the number of total ICU cases increase, and about 330 patients required what do you call it, ventilator support. And with the new death cases daily getting increased, by now we have about 59 new total death cases. In Malaysia, they have about 26 referral hospitals for COVID-19 cases. And for low-risk COVID patients, they have set up a center, or we call it the quarantine center, at the Malaysian Agro Expositions Park Center, Park Serdang, with a capacity about 4,000 beds. Now, currently, the beds already maximum until the 3,883 capacity. So, in light with the COVID-19 pandemic and also the announcements during the first movement control order by the government, Malaysian Physiotherapy Associations and Ministry of Health formulate a set of guidelines that would enable physiotherapists to continue providing patient care and treatment during the MCO. I would like to thank World Physiotherapy and also Philippine Physical Therapy Association, because during that time, I'm adapting a little bit of information from the Philippine Physical Therapy Association guideline in terms of the standard operational procedure. Thank you very much for the information that I get from the your association website. Based on these two guidelines, this guideline is meant for the physiotherapists that are working in the hospital setting, because during this time, with the first MCO in March. Okay, during the first 3 months, the terms of frontliner is meant for only physiotherapy working in the hospital, either government or privates. Meanwhile, physiotherapists that working in the other sector, for example, private physiotherapy center, they have to close their center because of they are not considered during that time as the frontliner. So therefore, this guideline is meant only for the physiotherapy working in the government hospital. So again, this guideline actually helps the physiotherapy how to deal the patient, especially during the this guideline help the physiotherapy to manage patients with COVID-19, especially after the acute setting, and then they are transferred to the wards until they've been discharged. So the first thing will be the personal protective equipment, PPE is a compulsory where contacts occur with confirmed case of COVID-19 patients. So these preparations on the left side is most of the equipment that we use in order to rehabilitate patients post ICU, especially patient still not active as the COVID-19 patients. So with other equipment such as this equipment, we help the patients to perform the breathing exercise and then early mobilization in bed in terms of body position management, okay, ambulations and light aerobic exercise. We talk about walking, okay, exercise characteristics. As I think we all use the same protocol there, with the patient with less than 3 of the walk scales, okay, and then increase to 4 to 6, frequency 1 to 2 times a day, and duration between 10 to 45 minutes exercise. So after they've been discharged from the hospital, okay, discharged from the COVID-19, some of the hospitals provide the rehabilitation after COVID-19. Most of the hospital will call back the patients at least 3 to 6 weeks after discharge, and they will ask the patients to perform all the post-COVID rehabilitation program that are related to the pulmonary rehab program. So most of the patients have the symptom like the severe fatigue, okay, low physical endurance, and also reduce. Some of them might have reduced muscle strength and also the muscle mass. So based on this, based on the guideline from the World Physiotherapy and also some of the publication that we refer to, we come across that this is the type of program that we will we offer to the patients. So this is the program have been done in Hospital Serdang, Selangor. Okay, for as our patients, okay, in the hospital during the total lockdown, the hospital will limit the number of patients per day. Okay, normally during the every sessions depends on the capacity of the hospital or department. They will limit patient to 1 or 2 patient only in the single sessions. So all the therapists and patient need to wear a mask all the time. Okay, always practice hand hygiene. Okay, and after the session, there will be supportive staff will help in terms of disinfect area and equipment that have been used. So after the 3 months of the total lockdown, so the government has give approval to all the private physiotherapy centers, NGO, and also the private physiotherapy that perform house call to continue their service. And during that time, we have some discussion with between the Malaysian Physiotherapy Association and also the government, so on how to develop the tele-rehabilitation guideline, and also how to make sure that the home exercise program been conducted by physiotherapy based on the new guideline that have been developed by the associations. So by doing that on the 29th August 2020, so the Malaysian Physiotherapy Association and also with the Ministry of Health, we developed we performed the development of the home-based physiotherapy guideline during the COVID-19. Then this has been used for the physiotherapists that are working for the house call. And for the telehealth and or telephysiotherapy or telerehabilitation, we don't have any guideline yet. So far, as the MPA, we encourage our members to read and have a look at the Australian Physiotherapy Association telehealth guidelines. If anything that they want to know, they will refer to these guidelines. Currently, our associations and also the Ministry of Health, we are trying to develop our own telehealth guidelines to make sure that in the future we can continue the telehealth guidelines with the better procedure to make sure that patient is safe and receive the very effective physiotherapy program based on the telehealth. So, as we know, during the total lockdown, also we cannot perform all the face-to-face conference or workshops. So we are changing from the face-to-face to the webinars concept or the digital concept. We have performed quite a lot of webinars. We inviting all the speakers, internal or international speakers, in order to help us to maintain our CPD point and so on. So this is the first webinar conducted by Malaysian Physiotherapy Associations, followed by webinar by our chairpersons, Professor Dr. Su Fajeng, the chairperson of during that the WCPT for Asian Western Pacific. And we have invited Professor Dr. Kim Bernal, especially she expert on the telehealth for the management of osteoarthritis. We want to see that how Australian physiotherapy perform the procedure of the telehealth, especially for the patient with osteoarthritis. Other than that, we are very active during the first 3 months of the COVID. We have produced a lot of PPE, okay, with the collaboration with the Ministry of Health, all the therapies, including physiotherapists and occupational therapists. We produce a lot of PPE, for example, the gown, and we donate all the PPE sets to the hospitals that provide the management for the COVID-19 patients. So we were active in terms of donations, the face masks, okay, to the hospital Kuala Lumpur. This is a main referral center hospital in Malaysia. Okay, hospital in Johor Bahru, and also the University Malaya Medical Center. Okay, Hospital Johor Bahru, sorry, this is Hospital Johor Bahru. And other than that, we're also very active in terms of the educate patients in terms of the how to be active during the restricted movement control. Some of the therapists provide and produce video how to perform exercise at home, because we have the total lockdown most likely about the total lockdown is about 3 months, and later we have the restricted movement, another restricted movement about 2 months. So most of the Malaysian citizens are working from home, and most of them getting increase of weight. So therefore, our physiotherapy helps to produce a video and to make sure that they have the healthy fitness, and also can reduce the weight during the movement restricted out there. With that, thank you very much. This is what can I share with the audience in Indonesia. Thank you.
Thank you very much for all panelists for the fantastic presentation. Very well, now we come to question and answer session. And I would like to invite Mr. Michael Gabilo and Mr. Hadir Manaf to join us.
Sorry, I have to. All right. Okay. Sorry.
All right. I'm going to start off with a question for both panelists, which is I'm very interesting about telephysio or telerehabilitation, and research has shown that it has effectiveness. But based on your personal and professional experience, do you think that it could be the future of our profession, since we all know that physiotherapy is a hands-on profession? Maybe I'm going to start with Mr. Hadir Manaf.
Okay. We cannot deny about the rise of the digital or we call it as the internet revolutions for our professions. Even nowadays we have the robotic and everything's coming up. So, but still, this is the early stage. We have a lot of research showing that the effectiveness of telerehabilitations in terms of certain conditions, not all conditions that are suitable to do telerehabilitations. We have to see from the a lots of perspectives in terms of safety, patient private and confidentiality, and so on. So what the main issue in Malaysia is that we want to see that, for example, what happened to the patient if the patient has sudden what do you call it, sudden collapse, or maybe you prescribe any aerobic exercise that may cause patients to become collapse. So this is the main issue raised by the government itself. So we allowed you to do telerehab. So certain conditions that we need to see from different perspectives. So it's not only physiotherapy need to sit down. We have to sit down with other profession also, especially the cardiologists, the emergency department, to make sure that the setup is well prepared. For example, if the patient have collapse, this sudden collapse, the therapists know how to contact where is the nearest hospital or the emergency ambulance that they can call, and also they can have the earliest what do you call it, earliest management in terms of what happened to the patient if they have collapse. That's number one. Number two, the issue with that, in Malaysia, we don't have any insurance company that cover the telerehabilitation. So it means that the patient have to pay by themselves. So some patients are not eager to pay because they are saying that they are never been touched by the therapist. So, but some patients prefer to go for the telerehab during the COVID-19 because they feel safe at home. But again, this type of patient is patient that can perform their own exercise. For example, patient with OA, shoulder problem, they can do the exercise with the help of their caregiver. But we found that some of the therapists or the patients might have difficulty to perform exercise in patients with neurological conditions such as stroke and spinal cord injury, because the caregiver not keen to do the exercise because they're afraid that they don't know how to manage the patients, to how to handle the patient, especially the patient is still in the acute setting or the acute stage. But if the patient actually more than 6 months, they can walk already, okay, the exercise a little bit more on to maintenance and improve the gait performance, then should be okay. So based on the telerehabilitations, they found that it's good and improve the patient's gait performance after a few sessions. Is it answering your questions?
Yes, great. Thank you very much. And
Okay.
let's hear from Mr. Michael Gabilo.
Yeah, yeah. Telehealth on a bigger level has been in the practice of European countries and Western countries for the since 1980s, as far as my research is concerned. So in our region, telerehabilitation is relatively new, right? I think personally, I see telerehabilitation or teletherapy, what we call here, will really be part of the physical therapy services. But nobody, I think it will not replace the usual physical therapy interventions that we are doing, because from the name itself, physiotherapy, physical therapy, we really do a lot of interventions hands-on to our patients. There's physical contact with them. So I believe I believe telerehabilitation will be an adjunct. It will be a support, an alternative mode of delivering PT services. But yes, there are a lot of positive points of telerehabilitation, but we have to acknowledge the barriers, the different pitfalls related to telerehabilitation. I agree with the President of Malaysia. We have the same concern concerning the insurance, or how will the telerehabilitation be covered by insurance or by the government, subsidized by the government. So I think very important that all policies should be reviewed. We have to check the ethical considerations of telerehabilitation, not just only for the patient, but also for the PT itself, because there will be definitely some issues on the practitioner side. How are we going to ensure that we are really giving the best and the optimum care to the patient through telerehabilitation? So I think that should be highlighted in our decision making, whether we're going to telerehabilitation or we're going to do the typical or the usual treatment or the process of intervention that we give to our patients. So we have to be very guided properly with this, with telerehabilitation. And I think this is a best avenue. This is a good avenue wherein we learn from different countries. We see different perspectives. How do they practice? What are the concerns of these countries related to telerehabilitation?
Nice, thank you very much. And then I'm going to open a question from the audience at this point. But while we're waiting for the participants to join us, my next question will be starting with Mr. Michael Gabilo. We would like to know how the physiotherapy services in your country in the early phase of the pandemics.
Yeah, like in my presentation a while ago, when the World Health Organization declared it is pandemic, and when the President of the Philippines declared a state of calamity and at the same time imposed lockdowns, most of our physical therapists are really concerned, especially those who are in the private practice. When I say private practice, they do the home health care, wherein all transportations were shut down. They can't go to their patients. So everything is really, it's really chaotic at the time. So the association really responded quickly to it by coming up with frequently asked questions. And we injected in this document the different references where they can model and where they can get their answers. I think another thing is the economic side of this lockdowns. So as a banner in one of my slides a while ago, some of our practitioners in the country, if you don't work, you don't pay, you don't receive any remuneration. You don't receive professional fee. So we have to be very, how do you call it? We have to channel this concern to government agencies because they sometimes neglect physical therapy in the country. We really have to tell them, hey, there are physical therapists here in the country. They are also experiencing the same concerns of the dentists, the medical doctors. We also have that same dilemma. So, you know, I think proper channeling to proper authorities is a key why we were given that opportunity to be heard.
All right, thank you very much, Mr. Michael Gabilo. Next, how about in Malaysia, Mr. Hadir Manaf?
So yes, as I mentioned in the slide, so in the early stage of the COVID-19 or during the March, our Prime Minister declared the as a pandemic and the total lockdown for the Malaysian citizen for 3 months, and they only declare or classified frontliner as a physiotherapist that working in the hospital, government hospital and private hospital only. And for the private sector, not the private sector, the private center. Okay, the private center have to close their center for 3 months. So during that times, as a president, I have received a lot of emails, a lot of WhatsApps saying that we have to do something to make sure that all the private center should be declared also as the frontliners. Again, the problem is that during the total lockdown, even though that is the physiotherapy can be open during that time, but the patient cannot travel. That's the issue because they have a lots of roadblocks during for each district, and without the proper letter from the hospital, the patient cannot go to the center. That's also the problems that we're facing during the first 3 months. And then all the private center need to register with the Ministry of Industrial and Trades because of during that time, before July 2020, physiotherapy centers is not ready, it's not regulated under the Act 774. So started July 2020, physiotherapist professions is regulated under the Act 774, which we govern under Malaysians Allied Health Profession Councils. So after that session, after the Act is been gazetted in 2020 July, so we have more power, more voice to help the private center in order to reopen the center and manage the manage the patients during the COVID pandemic. But restricted, a very small center, maximum patient you can have is about 1 patient in a session. They have to disinfect the equipments and the room after the session. And they should have the declaration form to make sure that the patient is free from any symptoms before they come, at least 3 days before they come to the sessions. This quite, tedious things to do for the therapists. But Alhamdulillah, since now, even though we have the few types of movement control order, the physiotherapy center can open the services. And there is no cluster. Currently, we don't have clusters from the physiotherapy center so far, Alhamdulillah.
All right, thank you very much, Mr. Hadir Manaf. And now I would like to invite the Secretary General of the Indonesian Physiotherapy Association, Mr. Muhammad Irfan. Maybe you have some thoughts on this issue.
Unmute. Okay, thank you for Mr. Gabila and Dr. Hanif for your outstanding presentation. On behalf of Indonesian Physiotherapy Association, we really appreciate. I would give the information from the Mr. Saker that yesterday informed can to speak today, but we get a few minutes ago, we get information that Mr. Saker positive COVID now and now in hospital, so they can join with us. I think we can pray for Mr. Saker, then can be well soon. So that information from us, and thank you.
Okay, thank you very much, Mr. Muhammad Irfan. Now we already have one participant raising his hand. Mr. Rijal, you may unmute your microphone.
Okay, thank you. I thought this is really amazing presentation that I got today. And so from the presentation, I have two questions for two presenters this afternoon. And before I ask my questions, actually I want to say hello for Michael Gabilo. We had met in Bali, actually in Ichipa 2 years ago. And we talk about DPT program. Yeah.
Yes. Yeah.
All right. My first question is, as you said before, you try to develop interprofessional collaboration when you try to give a treatment related to COVID-19 cases. So can you describe us, or probably sharing your experiences, how to develop the collaboration between other health professionals to giving the physical therapy services properly in hospital? And the second one is, one of our weakness, especially in Indonesia, probably, especially for physical therapy who are working in the hospital, the physical therapists in Indonesia usually have a weakness in applying evidence-based practice. So how do you improve evidence-based practice for physical therapy in your country? Thank you.
All right. First up, probably from Mr. Michael Gabilo first.
Hello, thank you for the question, and it's nice to see you, although we are seeing each other virtually.
Yeah.
I hope you are also well and safe along with your family. Anyway, to answer the first question, how do we collaborate? Collaboration. I think that's one of my important messages a while ago, that we really strengthen collaboration because, no man is an island. We cannot give really, we cannot expect the patient will be totally recovered from the condition like COVID-19 if it is just physical therapists or it is just medical doctors alone. I am not really working in a hospital, though I am an educator, but as the president of the association, we always emphasize to our colleagues, to our clinicians, that constant communication with the team, whether it's an OT, a medical doctor, the caregiver. We have to really emphasize the role of caregivers, the family relatives, the relatives of the patient, in ensuring the exercises will be properly performed at home. I think that's a key in a successful physical therapy program. Going back to communication, very important that you deal with the medical doctors, with the referrals, because in the country we are not just only accepting referrals from rehab doctors, we are all duly licensed physicians. So I think we have to establish that kind of relationship with them, that we do not eliminate. I always tell that to my colleagues. We do not eliminate anyone in the management of our patients. We have to work together with them. As to the second question, evidence-based practice. Again, we are receiving most of the time referrals from doctors. Sometimes our country is, I don't know in your country, but in our country we have this two types of referral. One is what we call an open prescription, and one is a closed prescription. Because there are doctors wherein when we say closed prescription, they really itemize what to do. You know, what will you do? There are doctors that will just simply write in their prescription pad, refer to physical therapy. That's it. For those who are doing a closed prescription, and we think that these are not really beneficial, no, it will really not give any progress to the patient. Again, the emphasis of communicating and courtesy to the medical doctor, so that to these professionals should also be properly implemented by the physical therapists. So if they think that this is not really an intervention that is supported by evidences, then you tell that to the doctor, because the doctors are also open-minded, and they will just listen, because at the end of the day, it will always be the patient's welfare that will have to be considered all the time. And I think last thing before I transfer the floor, it should, as early as the education, or as early as the formative years of the physical therapy student, evidence-based practice should already cultivated in them. Because once they practice, they will always go back to this. This will be something fundamental to them. So that's how I think how I will answer the question. Thank you.
Thank you.
Thank you very much. And Mr. Hatir Manaf?
Yeah. Okay, I will answer question number 2 in terms of evidence-based practice in Malaysia. So as you know, Malaysia started the physiotherapy program by having the certificates, later on upgrade to diploma in physiotherapy. And in 2005, we have the first program in bachelor in physiotherapy. So after that, our programs is growing. We have the master by coursework, master by research, and then we have the PhD by research in physiotherapy. So the culture of evidence-based is still new in Malaysia. What we can see is the transition we have currently numbers about 60% of physiotherapy in Malaysia with diploma holder and 40% with degree holder. So as we know that diploma holder, we previously never encouraged them to do research. Okay, there is no syllabus for them in terms of evidence-based practice. So the transition is that what we do is we started to do a lot of a workshop. We make sure that the syllabus in the bachelor program, we have the research methodology, all the evidence-based. Every subject should have the evidence-based, how to get the evidence, how to interpret the evidence. And not all students, not all therapists know how to read a research paper, especially the systematic review, and how to interpret the meta-analysis, the forest plot. It's not easy job for us to help the therapists, but it's growing. We help them, all the lecturers in the university that know how to interpret the forest plot, or how to create the guideline, help the therapists in Malaysia in terms of knowing about the evidence, what to choose, what is the best evidence in that area, rather than they are reading all the RCT paper, we don't know about the RCT. Yeah, we started with we guide them to read systematic review. Just use systematic review first, and later on how to interpret the forest plot. And slowly and gradually, they know the terms and don't know how to read the paper. When we introduce them with the Cochrane advanced library, everything, so should be the problem in a 5 years time, inshallah.
All right, thank you very much. As we can see, this has really been a fascinating panel as we go forward. Unfortunately, we have very restricted time schedule to follow. In a short word, what's the final piece of advice you'd like to the audience to take away, Mr. Hadir Manaf?
Okay, for me, our challenges now is in Malaysia in terms of COVID-19 is to provide the post-COVID-19 rehabilitation program. Currently, not all hospitals that provide that services, and we want to make sure that all patients that have all the symptoms can recover, because our role is very important after the COVID. All the fatigue, all the reduced muscle strength, all the fitness level, So we are the person that importance to make sure that the patients return to at least 90% of the previous condition before the COVID-19. So my approach with the governments to make sure that not all, but at least 30% of the hospitals and also the private sector can provide the program. But again, once you really set up the post-COVID rehabilitation program, there's a certain limitation in terms of the other patient who would like to come, the stigma in terms of you having the COVID patient in the gym. So some patient, the other patient would like don't want to come to the sessions. So that are the issue that we need to overcome after this. Okay, that's all. Thank you.
Thank you, and Mr. Michael Garillo. It's still unmute. It's still mute.
Still mute.
What about now? Okay, sorry about that. I had problems with my connection. Anyway, none of us really knows how when this pandemic will specifically end. I think as professionals, as physical therapists, we were trained to be lifelong learners. We were trained to be self-directed learners and proactive. I think we need to really act, prepare, respond, and recuperate on this. We need to be proactive. And again, I'd like to highlight the word collaboration, because this will be ingredients to a very successful outcome of this pandemic. We always see pandemic as the negative, it has a negative connotation, but I think the opportunities are there. We need to really do work. We really need to work together so that we can overcome the intertwined health and socioeconomic consequences of this pandemic. So let us all be united. And I think all physical therapists in Indonesia, Malaysia, in our region, we just need to open our lines of communication so that we can share resources, we can share the best practices, because from there, I think we can win the situation. Thank you very much for the opportunity.
Thank you very much. Once again, thank you for your time and joining, also sharing with us. But before we end the session, let's take a picture. All right. Thank you very much, Mr. Michael Gabilo and Mr. Hazir Manaf. We really do appreciate your perspective and inputs on how Physiotherapy Association managing pandemic issue. Also to the audience for your active participation. For take-home message, we can learn many lessons from the cumulative experience and the role of physiotherapy in this pandemic. Despite many challenges, solid strategies and actions will help physiotherapists to adapt and ensure patients can safely continue treatment. In fact, physiotherapists can have a key role in this pandemic. Good afternoon. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Back to
to Ms. Faiza Abdullah and all the panelists. Such a remarkable presentation and interesting discussion from each country. And that was the end of our International Conference Physiotherapy 2021 today. But before we end this international conference up, we have some announcement for the champion of the competition Road to the National Congress of Indonesian Physiotherapy Association.
Terima kasih kepada rekan kami Faizah Abdullah yang telah membawakan acara diskusi panel pada kesempatan siang hari ini. Hadirin yang berbahagia, acara selanjutnya adalah pengumuman pemenang dari beberapa lomba dalam rangkaian menuju Kongres Nasional Fisioterapi Ikatan Fisioterapi Indonesia ke-13 di Yogyakarta. Untuk itu, selanjutnya akan kami umumkan para pemenang dari masing-masing lomba. Lomba pertama dari Lomba Karaoke Mars Ikatan Fisioterapi Indonesia. Juara 3, Agung Ramadhani, mahasiswa Universitas Aisyah Yogyakarta.
Juara kedua, Fabib Abdullah, IPI Cabang Surabaya.
Dan juara 1 adalah Daniel Adi Saputro, IPI Cabang Semarang. Hadirin yang kami hormati, pengumuman selanjutnya adalah pemenang dari lomba poster. Lomba poster dalam rangka Titapi. Kategori mahasiswa. Juara 5 Sabrina Eka Fitriani dari Universitas Indonesia.
Juara keempat, Ina Samani, Universitas Indonesia.
Juara 3 Zaes Abdul Mahdi, Universitas Aisyah Yogyakarta.
Juara kedua, Nurdina Dwi Yahya, Poltekkes Kemenkes Surakarta.
Dan juara 1 adalah Clara Hairun Nisa, Universitas Indonesia. Selanjutnya akan kami umumkan juara film pendek. Mohon maaf, selanjutnya akan kami umumkan juara untuk lomba poster kategori praktisi. Lomba poster kategori praktisi. Pemenangnya adalah juara 5 Jerry Martais dari Universitas Esa Unggul.
Juara keempat, Hias Elsa Yuniarti, Fresh Graduate Universitas Aisyah Yogyakarta.
Juara 3 Ika Fitri Wulandari, Unisa Yogyakarta.
Juara kedua, Yusuf Nasruddin, Poltekkes Kemenkes Jakarta 3.
Dan juara 1 adalah Abdul Khalik Meidan dari Tokyo Metropolitan University. Baik pemirsa, selanjutnya kita akan umumkan lomba film pendek untuk kategori pimpinan cabang dan pimpinan daerah Ikatan Fisioterapi Indonesia. Video short movie. Juara 3 IVI Cabang Boyolali.
Juara kedua, IVI Cabang Slawi.
Dan juara 1 adalah IVI Cabang Bantul. Saudara pemirsa, selanjutnya akan kita umumkan kategori klinisi atau mahasiswa untuk lomba film pendek. Video short movie kategori klinisi dan mahasiswa. Juara 3 Adnan Faris.
Juara kedua, Physio Babe.
Dan juara 1 adalah Ridik Limbo. Pemirsa sekalian, yang terakhir kami akan umumkan juara lomba isai.
Untuk juara lomba isai, yang pertama juara harapan. 1. Endah Wahyuningsih. 2. Pratiwi Febrianti. Yang ketiga, Siti Nadir Olin Norlinta. Yang keempat, Milenia Vina Sakola. Yang kelima, Sigit Haryono. 6. Triwibowo. 7. Damha Albana. Dan yang terakhir, Jerry Maratis.
Kita umumkan juara lomba isai peringkat 1 sampai 3. Untuk peringkat 3 ada 2 peserta. Juara 3 ada 2 peserta. Yang pertama, Jerry Martis. Mohon maaf, Jerry Maratis. Dan Iklima Nurdinia. Juara 2 lomba isai, Gina Fasrina. Dan juara 1 adalah Arif Fadli.
Congratulations for all the champions. As saying goes, to every beginning there is an ending. And now the International Conference Physiotherapy 2021 has come to an end. Once again, thank you very much to all speakers and participants for gracing our international conference with your presence. We really appreciate it. On behalf of the organizing committees, we would like to apologize if we have done any mistakes throughout this event. We end our duty as a master of ceremonies today.
Hadirin yang berbahagia, demikian pengumuman lomba dalam rangka menuju Kongres Nasional Ikatan Fisioterapi Indonesia ke-13 di Yogyakarta. Kami ucapkan selamat atas partisipasi dan berkenan berpartisipasi pada kali ini. Hadirin yang berbahagia, tibalah saatnya kita berada di ujung acara. Maka kami, Galih dan Aprilia, undur diri dari hadapan Bapak Ibu semuanya sekaligus menutup acara International Conference pada hari ini. Sebelumnya kami ucapkan terima kasih atas dukungan semua pihak demi lancarnya acara pada pagi hingga sore hari ini. Sebagai penutup kami akan sampaikan sebuah pantun dalam bahasa Jawa Yogyakarta. Dahar kupat ngagem santen, kathah lepat kawula sarencang nyuwun pangapunten. Billahi fisabilil haq. Wassalamualaikum warahmatullahi wabarakatuh. Nuhun.